Hello, everybody. You are very welcome for third time in Patient Organization Networking Day. I would like to welcome also attendees that are online and with physical presence here, patient representatives and patients around the world. It's a special day today because it's the 10th year that we are gathering in this day, and this seems that something good happened here. Every year is increasing the audience that's coming for more and more countries, and today we have 151 attendees. Congratulations to all of these attendees. I hope that after the day you will become smarter and with more knowledge when you go out of this auditorium. And now it's time to thank, to make a big thank, to the working group that have prepared a really good agenda that will learn a lot of global leaders also from scientists and patient representatives among different countries. So I would like to welcome Jean-Michel Fourier, Liam Galvin, Lilia Gendet, Stefano Pavanello, and Justin Hamid. Thank you very much. And it's an opportunity here with this beautiful agenda to share experience, discuss ideas, and make new connections. This year, I have some moments to speak an experience that I have, and I tried to put some photos together to help me to express what we have lived during this year. So the annual diary, if I have to split it regarding the time that we invest, 70% is meetings, as you probably understand, and I think that you do the same in your national organization. 20% presentations, and I include in this time the time to prepare all of the slides, and 10% travels. And when you finish this, you make it again, and again. So regarding the time invested, this was my year as CLF chair. But if I have to select 3 highlights of the year that we are running, the first will be in Brussels, the big event that we have made in Brussels, in the heart of the European politics. And here you can see the team of BOD and not only. We went there, we raise our voice, we make advocate in a high level. You can see all the teams, and we have a speeches, a lot of speeches in the parliament. And we have a big achievement that will help us to go further. We have created a team of MEPs, European Parliament members, dedicated in the lung health that will help us to address the advocate in European level. So this was the first significant milestone we have achieved early in the year. The second one was the trip in Cartagena, in Colombia, that we have also before some months. This gives us the opportunity to speak in global audiences together with WHO and WHO. We were, I think, the only patient representatives there to bring the voice and the problems that the patients and the lung health happened, especially with environmental issues, that is totally connected. You can see also Maria Neira from WHO, and we have some good presentations here. And we also learned so many things regarding the environment. Here is an Indian doctor that presents so shocking pictures that in Asia, in India, the environmental damage so much the lungs that a lot of people dies because of atmosphere. That here in Europe, we don't understand it. Because we don't see it, but when we don't see it, it doesn't mean that there is no problem. So part of the agenda today is today here. And the third milestone, I can go more nationally, it was that having all of the experience of here, we founded in Greece an umbrella association for respiratory and lung health. And here we can see in the photo some colleagues of this, Eleni, Carlos, etc. And taking the experience of all of this, we have found it in Greek to see what we can do in national level. So this was the diary photos. But if I want to reconnect the dots of the pictures that I show you, you can see a spirometer test in Cartagena. So how it is to make a spirometry test international. Then how to make it inside the parliament, in European level, and trying to bring the advocacy inside the center of, the center of taking choices and decisions. And then how it is to do it in your country with different difficulties. And the Greece has a lot of islands, so it's very difficult to have, to give the appropriate services in healthcare. So these dots, for me, means that we take good examples around the global, around international, around the world. You can see what happened in Europe, and then we can bring all of this knowledge to operate in our countries. And this will be the theme of today. So the theme of today is how we get improving respiratory health, thinking globally and acting locally. So now we go to a poll to see what is the knowledge that you have as organization supporting the WHO lung health resolution that we have given you an email to read. So we start voting to see, be honest. And if you are honest, we will see what is the improvement of the knowledge that we will have before and after the conference. Okay, you seem a lot of people confident, and I see a lot of space in getting better and getting more knowledge. So, close the voting. The mission today that everybody has here is that, first of all, don't forget that everybody in this room and online has a specific role to play. You are representing thousands of patients, and make your time here worth it. What you have to do, it's very simple. You have to hear the agenda and the speakers. You can learn from different countries and different sections. Next. We can discuss among us, we can keep notes, and then we can go back to our countries to see what is the best action that we can make. Having said that, we are closing the opening, and now we can go to my friend Liam. And what is your short name? Luis. And Luis, that will manage and the conversation that will happen there. And have a seat, and let's start. Thank you very much.
Thank you, Dimitris. As Dimitris, I'm Liam Galvin. I'm a board member of the European Pulmonary Fibrosis Federation and chair of the ELF Patient Advisory Committee, who worked on the working group for this meeting. So it's my pleasure to welcome you to Amsterdam, both in person and online. And also, it's a pleasure to co-chair this meeting with my co-chair, Louise, who I will now hand to.
Thank you, Liam. My name is Louise Bouwman. I am a patient advocate, and I am the current president of the Dutch Pulmonary Hypertension Association. And I'm also a board member of an umbrella organization, which is the Alliance for PH. And I'm actually very honored to welcome you in my home country. And I look forward to sharing together with you, Liam. And I want to go to give the word to you because there's some housekeeping messages, I suppose.
Yeah. Yeah, so just before we start, we'll just do a bit of housekeeping. So I'll just show the slide. So there will be questions and answers after our keynote speakers. There'll be another session, question and answer, then after our second set of speakers. So if you're in the room, you can just raise your hand. Someone will bring a microphone to you. Or if you're online, just put your question into the Q&A box, Myself and Louise will be trying to get as many questions and answers during that end sessions as we possibly can. If you need support, there are ELF staff in the room. You've probably met most of them. There's also an online help desk, and you can find the ELF email address on the slide if you need support. And the event website has details of today's program and speakers, so you can just scan the QR code. Now, this event is being recorded, and you'll be able to access it on the website in due course. That we'll try and get you the link as soon as possible. There's also a photographer who will be going around the room. If you don't want your image taken, please just let them know. Other than that, you might find fame on the ELF website. So please do get involved on the social media. The taglines are there. Try and really support the social media output of ELF and ERS during this Congress. And just another thing then, we've built in breaks into the program. Hopefully that's enough time for you to sort of rest and relax and more importantly, network. But if you do want to leave, just walk out quietly. You're free to come and go, because congresses can be quite a strain and a burden on patients. And finally, basically, just make sure your mobile phones are switched off or on silent, and I'll just hand you over to Louise now.
And don't forget to mention that the toilets, because there are no toilets here in the surroundings, but if you go straight through and go to the exhibition area and turn right, then you'll find the toilets under your right hand, and you don't have to walk stairs, and it's also available for people with a wheelchair or something. So just to know that you can go to the toilet and it's not that far. And now it's my pleasure to introduce the next speakers from the European Respiratory Society, the current ERS President Silke Ryan, and ERS President-elect Professor Joanna Chorostowska, which will be the new ERS President, of course. Professor Silke Ryan is a consultant in respiratory and sleep medicine at St. Vincent's University Hospital in Dublin, and is an internationally renowned expert in respiratory sleep disorders such as sleep apnea. Well, as said, she is this year's ERS President. And I will also already introduce Professor Joanna Chorostowska. She is a consultant in respiratory medicine at the National Institute of Tuberculosis and Lung Diseases in Poland. Her clinical and research interests lie mostly in lung cancer, COPD, and a difficult one, alpha-1 antitrypsin deficiency. Professor Chorostowska is the president-elect of ERS and will take over from President Ryan during this ERS Congress. Silke, you can take the floor. The floor is yours.
Yeah, thank you very much, Louise, and thank you, Liam, and really thanks to the all ELF team and to all the organizers for inviting me to your networking event. I mean, it's such a great pleasure for me to be here. I was here last year, enjoyed it immensely, and I'm really delighted to be back. I mean, looking at your program and your list of speakers, I can only congratulate you. I mean, I'm sure you're having a memorable and productive day. I so wish I could be here for longer, but unfortunately, as you probably can imagine, my schedule does not allow it. But as I said, it's an enormous pleasure for me to be here. I have recognized with great delight the enormous interest in this event and the fact that the on-site attendees were sold out weeks before the Congress. And I also note a very huge group of people who are following online. I mean, this demonstrates your fantastic commitment and dedication, but it is also testament of how far we come in the collaboration between people living with respiratory diseases and respiratory professionals. The relationship between the European Respiratory Society and the European Lung Foundation is unique. It's a great strength of both societies, and we need to cherish and to foster it. it's very special to me, and truly, if I wish to highlight one special thing of my ERS presidency, then it is my interaction with you and the absolute natural image of having professionals and patients side by side, being partners, being friends. You probably agree with me, that hasn't always been the case. And believe me, I'm not just saying this because I'm here and I want to say something nice to you. I have learned so much from you during my presidency and my time as leadership in the ERS. I mean, just an example. I mean, I have been practicing sleep medicine for over 20 years. I have treated thousands of patients. But hearing the story and the testimony at this year's Sleep and Breathing conference of a patient who was dismissed and inappropriately denied CPAP treatment by her treating doctor, and then she subsequently had a car accident, had me in tears. So I'm particularly proud and grateful of the successful reformation of the Sleep Patient Advisory Group. And I really want to thank everyone, Claire, Luca, everyone who was involved in making this possible. And we had a subsequent first patient conference, which was a great success. And I'm looking forward to continuous activities with you on this topic. I mean, all activities which we do as clinicians and scientists must be grounded in real-world experiences. And to see this so naturally reflected at all ERS activities now, and in fact here at Congress, is a great achievement. So I wish you a wonderful time at the ERS Congress at the beautiful city of Amsterdam. And I hope you can I can meet you, many of you personally, during the time here at Congress and outside. I hope you can join me on Tuesday morning for the long run or long walk. It's really for a great purpose, and also a testament to the wonderful Healthy Lungs for Life campaign. So thank you again for allowing me to say a quick hello to you, and I wish you continuing success at this event today. Thank you.
Thank you very much, Silke. I now invite Joanna to share a few words.
Hello. It's a real pleasure and honor to be part of your event. As the incoming president of the ERS, it's also for me an opportunity to use my past experience for working even closer with you. I can only echo what Silke said in terms of what the ERS and how the ERS has been working with the patient organizations. And I think that together we can truly achieve a lot. And there is a lot that needs to be done in Europe and outside. There are new challenges in terms of environmental issues, cleaner issues, but not only that. And I think we are actually in a position to really raise a voice and change this, at least try to change the situation. I must say that my professional experience that embraces both rare disease, alpha-1 antitrypsin deficiency, not that difficult if you practice a bit, as I did, have practiced for many years now. And now it's also lung cancer, recently in terms of lung cancer screening. And that puts me, I think, in a perfect position to really understand the importance of early detection of both common and rare diseases, and working with the general public, with populations at risk. And for that, your voice as patient organization is invaluable. So I truly hope that I would count on your support in the incoming year. I think that ERS is, as the biggest medical association in the respiratory field, gives us an opportunity and in a way, a power to influence the policy makers, decision makers, and coming together as patients and medical professionals, we really could influence a lot of decisions. And since Silke shared her personal experience, I thought I should do the same. And what came to me as a first idea is really what happened many years ago. I remember my very first patient-led event organized by Alpha One patient organization. And I was so much impressed of how patients are organized, and I learned so much from you. And it really changes the perspective, looking at the disease from your point of view, to understand more than just physiology and diagnostics and the treatment. This is our obligation, but to look at those issues, those problems from your point of view, I think is crucial for any medical professional, because that gives you this much more in-depth understanding what the dyspnea means, what the cough means, how much it affects your life, and how important it is for us to react properly and, well, do our best, really, but also be with you on the same page. So I think now it's a time to say thank you. Thank you for my past experiences, and I'm looking forward to new experiences and to what we can do together. Thank you.
Thank you both for joining and sharing your experiences, but also a vision for the future. And I can imagine there are a lot of questions from the audience to you, but we have to wait a little bit because this will take place in the question and answer session. So just a moment. Now I have the pleasure to introduce our first keynote speaker, Maya Mailer. Maya is the co-director of Our Kids Climate, a global organization supporting community leaders worldwide to push for clean air, or I heard healthy air is a better word, and climate solutions through parent-led and family-friendly initiatives. Maya has built her career in campaigning, strategy and coalition building for climate and social justice with some of the world's largest NGOs. And she used to live and work in Africa and across the Middle East. The floor is yours.
Thank you so much, Louise, and to all of you, and to Pippa and the team at ELF for giving me and my colleague Teresa, who's also here, this opportunity. It's the first time for us at this conference, and it's such an honor to be here, to meet this community, to hear from you, to learn from you. And also I want to say a big hello to everyone who's listening online, wherever you are in the world. I'm Maya. I'm the co-director of Our Kids Climate, and I'm a mother of 3. Air pollution damages our health, and almost all of us are breathing polluted air. And I don't need to tell you that people with lung conditions are particularly vulnerable to breathing dirty air, and so are children. And in the face of this huge global crisis of air pollution, of the interconnected climate crisis, it is easy to feel helpless and to feel overwhelmed. I do at times myself. But I'm here today to share with you how a global community of parents and caregivers are coming together to clean up the air, and how all of us can be part of the solution. Our Kids Climate is a global grassroots network. We support parents and caregivers from over 50 countries to push for healthy air and for climate action, united by love and by determination. Mums, dads, aunties, uncles, grandparents, ordinary people doing extraordinary things. And before I share some of the stories from our network, I wanted to say a few words about my own journey. I started my career with a humanitarian NGO, Oxfam, and I lived for several years in South Sudan, where even the most basic healthcare was beyond the reach of many people, of most people. And I worked with incredible colleagues, and despite the most testing circumstances of war and conflict, they never lost their humanity. And to be honest, in those days, I didn't really think much about air pollution or the climate crisis. It felt very distant compared to the human rights abuses that I witnessed almost every day. It was only when I had my own children, my eldest is now 14, that it started to change. When they were younger, my kids would come back from school and ask questions. What's going to happen to all the animals, Mummy? How hot is our planet going to get? And I was also moved by the sight of young people taking to the streets. And that's when I realized, that's when I truly internalized that any fragile progress we were making in, for example, eliminating diseases or advancing human rights risked being fatally undermined by the climate crisis. And so I connected up with some mothers in my local neighborhood of West London, and we decided to get active. We formed a group called Mothers Rise Up. I feel like the mic has gone. Can you still hear? Okay, excellent. So we formed a group called Mothers Rise Up. We were 6 or 7 women. We had no budget, we had no infrastructure, but we were able to get thousands of people out onto the streets, and we organized a big family-friendly march. And ever since then, we've been campaigning for a shift away from polluting fossil fuels to clean energy. And we work with musicians, with artists, with giant props, to relay our message in a creative, joyful, and peaceful way. And through my work with Mothers Rise Up in London and in the UK, I connected up with the global network, Our Kids Climate. And I started talking to mums and dads from all over the world. At first, this was all on Zoom, all online. And then I got to meet some of these mothers in person. So we came together at the UN climate talks in Glasgow, a delegation of mothers from around the world. We hand-delivered a letter to the then COP president, Alok Sharma, a letter from 500 parent groups explaining how air pollution was destroying children's health. This letter had an influence on him, and it contributed to a strong policy outcome at that COP, at the UN climate talks. And it was in that moment, and countless moments since then, that I've really seen and felt the power of parents, especially mothers, coming together. And I just saw how many parents were putting their all into the fight for clean air, for healthy air. And when I was in Glasgow, I happened to share a room with a mum called Camilla. And you can see her here with her son, Julian. Like me, she has 3 kids. Her sons were all born strong and healthy in Warsaw, but they quickly fell into a cycle of respiratory illness. Endless hospital visits, so much worry. Camilla even told me that her husband and her felt like they were inadequate parents. Then came a turning point. On a family trip outside of Poland, her kids quickly started to recover, only to fall ill the minute that they came back home. And that's when it clicked for Camilla, that her children's ill health and their suffering was directly tied to the burning of coal and the air pollution that it was producing in Warsaw. Over 90% of children are breathing dirty air every single day. And children are particularly vulnerable because they're still growing, they're still developing, they breathe faster, they stand closer to the ground where pollutants tend to accumulate. And this exposure to air pollution damages their health, and it can damage their health for life. Throughout this work, I've had the privilege of collaborating with Rosamund Kissy-Deborah, and many of you will know her story and you'll recognize her from the photos. Her daughter Ella died when she was only 9 years old due to severe asthma. And Rosamund didn't accept this. She relentlessly asked questions and together with healthcare professionals was able to establish a correlation between Ella's asthma attacks and spikes in illegal levels of air pollution in Lewisham in London, where they lived next to a very busy road. And thanks to a tireless legal battle, Ella became the first person in the UK, if not the world, to have air pollution listed on her death certificate as a cause of death. And we really owe Rosamund a debt of gratitude for her work, which has opened up so many avenues for change and raised awareness about the deadly impact of toxic air. And we do know the root causes of this crisis. It's the burning of coal, oil, and gas. And we can feel the impacts. Our planet is overheating. I'm sure that some of you have been caught up in the wildfires and heat waves across Europe this last summer and around the world. And we know that extreme heat worsens pre-existing health conditions. And so that's why we continue to push for a fair and a fast shift away from fossil fuels to safe, abundant, and increasingly affordable, clean, renewable energy. We do have the solutions, but too often what is lacking is the political will. We believe it's really important to share positive stories, to share that change is possible. And that's why we launched our flagship campaign, Our Kids Air, to shine a spotlight on change that is already happening across neighborhoods and nations. So in India, mothers are planting trees, they're monitoring their air, they're sharing their stories in the media. In Poland, parents like Camilla have created buffer zones around schools which are free from pollution. In Kampala, Uganda, dads are working with mechanics to clean up the dirtiest vehicles. And honestly, the list goes on, and I don't have time to share it all. But it really is just a glimpse of what is happening across our community, from Ecuador and Mexico and Brazil to South Africa and Ghana and Australia. Grandparents, parents, young people, caregivers are coming together to clean up the air so that we can all breathe healthy air, which we think is the right of all children, no matter what country they happen to be born in. And we also do come together at big policy conferences on the global stage because we need change at the local level and at the global level. And we have to remind decision makers what is at stake: our children's health, our children's futures. The theme of this conference is thinking global and acting local, and that is exactly what our movement is all about. It's about local communities coming together to drive that systemic change. And what I want to say to all of you is, please don't underestimate the power of your own story, the power of coming together. And as parents, We carry a trusted and unifying and authentic voice. And the social science data backs this up. When we speak about love and care for the next generation, it resonates across divides. And in what can feel like a very frightening and polarized world, we think it's really important to relay that unifying and love-led voice as parents and as caregivers. To close, I'm going to share a video from the Our Kids Air campaign that gives you a little snapshot of our work and of the love that fuels what we do every day.
Every breath tells a new story.
Mom, we've got a baby girl. ¡Oh! ¡Lo hizo! ¡Lo hizo! ¡Ah! ¡Lo hizo! ¡Dio sus primeros pasos! Good job, Dad. Das sounds little.
We dream of a world where our children grow strong and breathe easily. Yet each day, a new chapter unfolds. Pollution fills small lungs with every gasp and wheeze. Trips to the playground, now hospital visits. Playdates replaced with doctor appointments. Inhalers always within reach. Clean air is every child's human right, but pollution is stealing it away. A parent's worry is no longer silent. What was once a whisper of comfort has become a roar in the streets. Demanding the air their child deserves. This isn't just a fight for clean air. It's a fight for the breath of life itself.
Thank you very much.
Thanks very much, Maya. Really good presentation and a really powerful video there at the end. We'll come to questions after our next speaker. So it's my pleasure and honor to introduce Dr. Barbara Hoffman. Dr. Hoffman is a professor of environmental epidemiology at the Heinrich Heine University of Düsseldorf, Germany. Her research focuses on the investigation of the health effects of air pollution and noise. Dr. Hoffman is also the chair of the ERS Advocacy Council and is engaged in European policy making, bringing scientific evidence to the policy making process. Dr. Hoffman, thank you.
Well, thank you very much. And this was very impressive. And now we're going to switch gear a little bit and go to the science behind it. Because what Maya just so impressively showed us, that rests on science that has been accumulated over decades and that is now under threat. And not only this science, but other scientific approaches and successes as well. And that's what I want to talk to you about today. So I have no conflicts of interest. Why do we need science in healthcare? I mean, one example was given here already, but here are some others. I don't know whether anybody of you still remember this. This is rickets. We don't see this anymore. It's from vitamin D deficiency in kids that have been working or that have not had enough sunlight during their life. Or this here. This is the last case of smallpox. We just don't know these diseases anymore, such as similar to others. They're gone because due to science, we know how to treat them. And here are some success stories also. Dirty air, while it's still bad in many areas of the world, at least in some, it is getting better. I mean, the air is starting. We are successful in cleaning it up. We're not there yet, but it is getting better.
Smoking. It wasn't until the 1950s that smoking was even recognized as being dangerous, as being harmful, that there were some very important scientific studies in the 50s and early 60s that showed that smoking and later on passive smoking was bad for your health. Back until then, nobody knew. Decayed teeth, or the lack of decayed teeth. That's a huge success of scientific studies showing how to prevent the decay of teeth. So these are just a few out of many examples to show that science saves lives and it makes life better. So what areas of health and disease do we need science? Of course, we need it for primary prevention and health promotion. And what Maya said is one of the most important areas. It's about the identification and reduction of what we call modifiable risk factors. So things we can change. We know how to change them. One of them, of course, is air pollution. We know how to change and reduce air pollution. Another one would be, in the case here of vaccination, infectious diseases. We know how to save people from infectious diseases that can have long-lasting consequences. Then one step further, without science, there will be no progress in diagnosing diseases, diagnosing them early so then they can be treated. We know we need science for rehabilitation. So without this, advances in these areas will not be possible. And then, of course, very importantly, the different therapies and diagnostics that we develop, they need to be evaluated so we have the best possible evidence-based medicine that we can distribute to patients, and that are the basis for the guidelines that we are writing to provide best possible care. And of course, patient safety and informed decision-making depends on scientific progress. But, and I think you all know, science is under extreme threat right now. And this is the foes of science. They're loud, they get everywhere, and they interfere in many different ways. So what types of threats do we have to deal with here? So a few methods that are being used in science, in attacks on science. So one is misinformation and deliberate disinformation. And I have an example here from Germany. I'm from Germany, obviously. In 2019, there were actually a few pulmonary doctors that went out and said, you know, the air pollution from diesel cars, that's not dangerous. You know, you can inhale it. Some even said that the air coming out of a diesel car, out of the exhaust pipe, is cleaner than the air that it's, you know, sucking in. I mean, this was just ridiculous. But it really resonated in the population. So they were very successful in throwing this out into the politics and in the general population. Another method of putting a threat on science is censorship and self-censorship. And that has, you know, there can be very open methods, open ways to censor something by just not, you know, allowing something to be printed. But there are also very subtle ways, not funding certain studies, not allowing certain publications to get into, you know, good journals. There's also self-censorship in a case of preemptive obedience, when scientists suddenly don't put certain research topics into their research proposals anymore, just to prevent them from being excluded from funding instruments. Then, of course,
There's funding cuts. And this is something here in Europe, I mean, we're under great danger. One example, and I'll come to this later also, in the Netherlands, there's a huge cut in research funding that was just passed. And all over Europe, the far-right governments seek to cut billions of euros in funding from our European research program. And then another subtle way to inhibit research and science, it's just to restrict access to data or to stop collecting data. One example is what the EPA is doing right now. They're just not measuring air pollution anymore. And that's easy. I mean, if you don't measure air pollution, you don't have any breaches of air pollution limits. Also, you know, decade-long data collection on climate change, it's just being stopped. And without that, we cannot do the research. Now, what are the sources? Don't forget science itself. I mean, we as scientists, we are responsible for some part of it, at least for the self-censorship. But there's political, economic, and also societal and ideological interference that is important here. What are the consequences? They are, of course, enormous. We have misinformation, misinformed public, misinformed patient decisions. There's a reduced trust in healthcare providers due to all this misinformation that's around. There are delays in medical advancement, increased health risk, and also very important, health insurance might not cover all the necessary interventions anymore because they're considered by governments as not necessary. So then insurance companies don't reimburse for these interventions anymore. And above all, it favors political decisions that are not in line and that do not promote health. So I have some examples, starting out with vaccine hesitancy. And you might be aware of it. This is not a new issue. As long as there are vaccines around, there has been vaccine hesitancy. And this is a nice review paper that gives a historical background. Here, this is about the smallpox vaccination that was as early as it was around. It was, there were people crying out against it. And I think what we're seeing now, Robert Kennedy saying there's no vaccine that's safe or effective, that's pretty much what we've had 300 years ago. Now, what are the reasons for the vaccine hesitancy that we see in the population? Several things play a big role here. One is complacency. It's, you know, we don't really perceive the risk anymore for many diseases because we don't see them anymore. Like what I showed you at the beginning, smallpox or rickets, we don't even know these diseases anymore. So the population and also patients, they're not aware that these are still threats to our health. Then there's a lack of confidence, lack of the trust in vaccine safety. There's, let's see, do I have a mouse here? Yes. Then there's the issue of availability and access to vaccines. There's also a loss of, you know, the feeling of collective responsibility, because as you probably know, for vaccination, you need like 90% of the population to be vaccinated to protect those 10% who, for whatever reasons, cannot get vaccinated. And also, by now, you need to get a lot of information and calculate, make your own calculations and see whether, you know, do you consider this as safe or not? And that this engagement in gathering sense of information is also seen as also a barrier to getting vaccinated. So there's quite a few reasons here. Another example that I brought with me is smoking. And what comes after smoking. If you put in smoking and strategy into the internet, you get the Wikipedia entry that's called the Tobacco Industry Playbook. And it says here, it describes the strategy used by the tobacco industry as early as the 1950s to protect revenues in the face of mounting evidence of links between tobacco smoke and serious illnesses. So in the 1950s, these first studies came out that actually showed that smoking is bad. And the tobacco industry designed a very nice and comprehensive strategy to fight against it. And this playbook has been used and copied for all kinds of other similar situations. It's very nicely written down in this book here, Merchants of Doubt. They detail every single step of this playbook and apply it to the smoking, the passive smoking, and also to fossil fuel industry and global warming. Now, the newest users of this playbook is the vaping industry, and they're using exactly the same tactics. And it goes beyond even the agricultural industry, and the nutrition and dietary industry are using the same playbook. And it always uses the same steps. It's deny that there is a health risk, spread doubt, and just openly lie about it. Now, why don't we have more political interference? I mean, we have politicians, they could do something against it, but they don't do enough, at least. And there's very often a merger of political power and economic interests. That's why we see so weak interference in tobacco, in nutrition, in air pollution, and in climate change. Very often there's support for ideology of the leading actors or their constituencies. We see that the vaccine hesitancy is a huge, in many cases, religious groups that pose or that constitute a large group of voters, and politicians just don't want to lose their votes. This political interference is also not really new. Here you see an article, Political Interference in American Science, why Europe should be concerned about the actions of the Bush administration. So this has been around for a long time as well. It's not something new here. These interferences are often very subtle, and I talked about some of the methods before. It's funding cuts, it's shifts in funding, it's simplification or deregulation. Here's an example, budget cuts in the Netherlands. Regarding simplification or deregulation, we have a very dangerous directive that's ongoing in Europe right now. It's called the EU Omnibus Simplification Package. That's a euphemism for deregulation. Wants to get rid of a lot of air pollution and climate change and other regulation laws. So we see this all around us, and we need to fight against this. What are the impacts on patients? Of course, it's decreased access to accurate information on risks and benefits. Official websites might not deliver objective information anymore, for example, on vaccination. There's increased skepticism towards vaccines, medications, and treatments, psychological fears. The result is we get unfavorable environmental conditions in terms of air pollution, extreme weather events, lack of tobacco control. I mentioned before, health insurances might not reimburse certain medical services, and overall it contributes to a worsening of health outcomes. So what are the strategies to protect science and patients? What can we do? We can encourage policies based on evidence. We can support open and transparent research. We can build alliances with other civil society institutions and promote science literacy. And we can strengthen science communication in the general population using formats that address different groups in society. And this is what ELF, together with ERS, is very specifically doing in a so-called middle-out approach. And you see ELF, right here in the middle as a middle actor. We advocate for science and scientific integrity.
We only have 1 more minute, Dr. Hoffman, if you could summarize.
And science-based policies towards the top actors. We educate fellow patient and patient organizations as other middle actors. And we try to counter misinformation, specifically to the bottom actors with social media campaigns. So my take-home message: science saves lives and makes lives better. We need to recognize threats to defend science effectively, and everybody can play a part here. The voice of the patient is a very effective means to communicate the success stories of science. So we need all of your voices. So thank you very much for all of your engagement. Thank you.
Thank you, Barbara, for this great presentation. And now we will move over to the Q&A session. And people here in Amsterdam, you can just raise your hands and or go to a microphone, because they're also somewhere. Oh, there is already somebody in the room. And for online participants, please post your questions in the Q&A box. Then we can answer them.
Okay, perfect. Yeah, we'll go to a question from the floor, but only don't have 10 minutes because we really have to go to a break as well. So your question, please.
Thank you. I would like to reflect a bit on the talks of Maya and Barbara. Barbara said something about the current right-wing and ultra-right-wing movement or tendency in the world, actually, also in Europe. And Maya was talking about things like clean air parents, clean air mothers, all things around clean air. I'm very, very happy that I can say this now where I'm standing in front of the president of ERS and the soon-to-be president of ERS, because I would really like to encourage you and everybody else actually here not to talk anymore about clean air, but about healthy air. We acknowledge in the Netherlands that, that when we talk about healthy air, it really makes a difference when we talk with politicians, when we talk with policymakers, because clean air is much more regarded with climate activists, etc. Well, healthy air, nobody objects healthy air. So please, let's all encourage each other in describing these things like healthy air. That's our job. We are people with health in our top of mind. So let's talk about healthy air. Thank you so much.
Thank you.
And any more questions from the floor? Or will we finish for a break? Question there.
Hello everyone, my name is Stefan Răduț, I'm from Romania. I'm a TB survivor and now I'm working in the TB patient organization. I'm for the first time in European Lung Foundation meeting. I'm very happy because Dimitri told me welcome in this morning. I didn't know him, and after that I saw him to go to the stage and welcome for everyone. And I understanding that I'm in the correct place. So regarding the presentation, we are in a strange world now. We are agree, everyone from this area, that the smoking is very bad, the gas stations are very bad. All of us, we use the gas station. All of us, we came here with a plane and we made a lot of bad things for the air. We need to stop a little bit and thinking how we can manage to move the smoking industry, the oil industry, and maybe the weapons industry, how we can replace them in the economy their roles. Maybe this is a long-term thinking, and I think in this area, in this hall, are smart people, and we can start to think about it. We cannot renounce to smokers. We cannot renounce to use the cars with gas. How we can replace them? Thank you.
I don't know. I mean, obviously, any fight against climate change and changing people's long-held ways of transport is going to take time, but we can only just start.
Yeah, I think you can hear me now. I'm not quite sure if I got your question or comments correctly, but I think what you're saying is to prevent tobacco industry to actually foster and be still present. Yes, I mean, I think everyone here in the room would fully agree with you that this would be amazing, right? I mean, we have to take it obviously in small steps. We are not the policy makers, right? I mean, we need to fight for even small steps, and these small steps can make a huge difference by having bans on smoking, ensuring reduction in second-hand exposures, and these are the steps which take already so much time and have shown us, but however, what we can do to prevent the tobacco industry from being present, that I think is quite a long-term future plan. But I mean, you can be assured that anyone here in the room will do the utmost possible to work towards that ultimate goal.
Hello? Yeah. Well, actually, I mean, in terms of smoking and also air pollution, we know we have the instruments. We know what needs to be done. We know how to clean up the air. It's just, as I mentioned, there's many interests against it. So that's what makes it so difficult. But the instruments are there. They only need to be implemented.
There's time for one more question, and I see somebody
one comment.
standing there.
Just one.
Oh, sorry. I don't know who was sooner, but okay.
I mean, is it on or not?
Oh.
Okay, I'll go first then. I think one of the questions is for people to really understand. And why am I saying this? Because I thought environmental issues, okay, it's a good thing. What turned me around was Eric Melen's talk at ERS a couple of years ago, when he was describing the Bamse study from Stockholm, which is perceived to be a fairly clean city, and how that affected the children in Stockholm. And I have said since, that was before I knew about your organization, that if grandparents really knew that they driving a car, because, okay, let me just, when your lungs create, they create like this and they stop and they start to degenerate, right? If that level is here for the grandparents, and due to pollution, their kids or grandchildren are starting here before degeneration. Their grandchildren do not have the same resources as their grandparents. If the grandparents knew that, you will have the biggest standing army against environmental change in the world. So we need to make people understand, and we need to celebrate their victories. He also said, when we removed lead from fossil fuels, we saw the effects within months. But nobody's talking about that. So we assume, we move on. We're moving from angry youth blocking traffic to grumpy old men who are saying that vaccines don't work. We need to find, and that's why I loved what you said about joyful work. We need something positive in that debate. Thank you.
Yeah.
The last question
Yes, not only
is great.
It's just for the information or for the encouragement of the people that who are working on those fronts where the people are getting disappointed. So why to talk about the smoking or the gas or whatever exhaust, since this cannot be stopped? Well, advocacy is something which has to be continued. This needs persistence, and it makes a difference. We may not eliminate it all, but it makes a difference. Just for an example, in Saudi Arabia, we had 75%, more than 78% deaths because of COPD 10 years ago. But because of multiple interventions like against smoking and other motivational and treatment modalities, now the death rate comes to be around 25%. So there's a huge difference in 10 to 12 years. So what I just want to say that don't be discouraged, remain positive, remain optimistic, and continue with the efforts that we are doing. May it be small, but it is going to make a difference over the time. Thank you very much.
I'm afraid we have to stop for a break now, so if you can all take your time, and then I just want to thank all the speakers and my co-chair, but if you can all return at 12:45 prompt. Thank you.
Welcome back, everybody. I hope you all had a very good break, and everyone here, well, it's not so many people now, but I don't know where everybody is, but please come in. And everybody is doing the best job to improve the life of patients. And I am delighted to introduce our testimonial to understand how these global topics are affecting people around the world.
I was diagnosed 15 years ago with chronic obstructive pulmonary disease. I had an exacerbation, which led to the diagnosis, and a pneumonia led to my retirement at age 55. I was once a big, strong, active man with many outdoor pursuits, and I am no longer that man.
Saya didiagnosis kanker paru, neuroendocrine high grade. Pertama kali saya merasakan nyeri yang mengganggu aktivitas saya sampai menggunakan kursi roda.
Soy paciente de hipertensión arterial pulmonar grupo 1 por cardiopatía congénita, clase funcional 4, con un diagnóstico de 16 años.
I had very little energy and regular chest infections until February 2022 when I became very unwell, and spent a considerable length of time in hospital when I was diagnosed with chronic pulmonary aspergillosis, bronchiectasis, and severe adult onset asthma.
The story I would love to share about my client that I managed was a 2-year-old who came in, had been diagnosed with TB. We could only do a chest x-ray and a few other tests, drug sensitivity testing. We didn't have an echo, wanted to rule out pulmonary hypertension, because seriously the problem was in the lungs because of the requirement of the low oxygen.
For many, many years, nothing helped and controlled my asthma. Despite being on many different types of inhalers and oral medications, it was very hard to manage. I lived daily with almost 80% of predicted lung capacity.
أعمل مع المرضى الذين يعانون من الأمراض التنفسية المزمنة مثل الانسداد الرئوي المزمن أو COPD. هؤلاء المرضى يواجهون صعوبات كبيرة مثل ضيق التنفس والتعب وعدم القدرة على ممارسة الأنشطة اليومية.
Although I have not experienced severe symptoms of this rare lung condition, which primarily affects women aged 20 to 40, I have worked closely with patients facing significant challenges. Many have been misdiagnosed, lost substantial pulmonary function, or rely on daily oxygen use. Some have even undergone lung transplants.
I have alpha-1 antitrypsin deficiency, and I'm a ZZ, so I have both genes. And this has led to severe lung restrictions, and I've had to give up my veterinary work because I just don't have the lung capacity to treat goats anymore. And this has caused me a bit of distress because I loved my work.
Currently, I am working in the field of the pulmonary rehabilitation for the people who are suffering from the chronic respiratory diseases. In one of the ongoing RCT study at our site, we are trying to assess the effect of home-based PR and center-based PM among the CRD participants.
Soy madre y cuidadora de un paciente que fue diagnosticado con hipertensión pulmonar en el año 2017. Ese momento cambió nuestras vidas por completo. En mi país, a pesar de que tenemos un sistema de salud universal, en el caso de lo que son las enfermedades raras como es la hipertensión pulmonar, se necesitan tratamientos de muy alto costo y esos no siempre son aprobados para los pacientes. En mi caso, a mi hijo le fue denegado el medicamento que necesitaba para seguir viviendo. Como madre, no podía rendir y llevamos el caso de mi hijo hasta la Sala Constitucional de Costa Rica. Luchamos por su derecho a la salud y gracias a esa lucha, hoy mi hijo se encuentra estable y agradezco a Dios profundamente por ello cada día.
Fatigue, headaches, and daily mucus are a constant reminder of what life is like living with a long-term chronic lung condition such as I have.
So living with severe asthma is definitely a problem for many people in this world, and we need to make sure that our air is clean so that we are not affected by pollution.
This summer here in Toronto, we had several rounds of wildfire smoke. This caused an air quality index of 11 plus, which is the maximum here in Canada. This was very difficult for me. It injured my lungs gradually over days.
It's distressing that the treatment I currently receive is not really helping very much. I can only walk about 50 meters, and I have trouble doing a lot of things.
Alhamdulillah, saya berobat ke RSUD Karawang, telah menjalankan kemoterapi sebanyak 6 kali. Berat badan saya naik 15 kg dan nyeri sudah sangat berkurang. Dan saya dapat aktivitas dan dapat berkumpul bersama keluarga, lagi dengan anak-anak di akhir hidup saya yang selalu mensupport saya.
Challenges were the investigations that we couldn't get at our facility, being a resource-limited country. Some facilities don't even have just X-ray. And also the other challenge of inhalers. We can't deliver inhalers without a spacer and a mask in his child who is 2 years old. So we had to also get a way of getting them the spacer and mask. And the inhalers also, because they're used for quite a duration.
تعد برامج التأهيل الرئوي علاج فعال لتحسين الأعراض وجودة الحياة، لكن وجودها في الأردن محدود جداً لعدة أسباب من ضمنها نقص التدريب وغياب الدعم والتشريعات.
Free access to sirolimus, the only effective LAMP treatment, has been transformative for Brazilian patients. Additionally, the establishment of 16 treatment centers across the country, specialized pulmonologist training, The creation of a patient registry and a lumbar support on social media have greatly improved the quality of life for those living with LAM in Brazil.
When the medication came out in 2003, I was placed on it, and within 6 months, the quality of my life has improved dramatically. Unfortunately, this drug is very expensive. Currently, I was looking at what my insurance covers for me and what the cost is, and it's close to 100,000 American dollars, and we're only in the month of August per year. Unfortunately, in Australia, we don't have access on the PBS, which is the government-funded scheme, to alpha-1 antitrypsin infusions.
Home-based PR underscored the role of digital infrastructure as connectivity and monitoring challenges pointed to the need for user-friendly technology and training for remote supervision. Social factors such as exercising in front of relatives, household environment, and space availability emphasized tailoring PR approaches to individual comfort and context.
A través de esta asociación, acompaño a pacientes que enfrentan las mismas situaciones y barreras que nosotros vivimos en su momento. El acceso a exámenes médicos, el diagnóstico oportuno y el acceso a tratamientos de muy alto costo. Hoy ayudamos a esos pacientes y caminamos con ellos y defendemos su derecho a la salud. Nuestra misión es clara: luchar, educar y empoderar a los pacientes en Costa Rica. Porque cuando los pacientes están informados, unidos y llenos de esperanza, se vuelven más fuertes.
That was a really good video, I think, really international, showed the many challenges, but really ended up with some real positives, all caused by people using patient advocacy. I'm going to move on now, and I'd like to invite the first speaker from our patient organisation network to come to the podium, Shane Fitch. Shane is the founder and president of Lovexair. She has dedicated 26 years to respiratory healthcare and advocacy on behalf of patients and caregivers, with a focus on digital health, preventive care, and global education. Over to you.
Thank you, Liam. I'm very happy to be with you here today and to have been witness to a fabulous opening session, laying out the challenges that we're all facing today in healthcare, but also joining forces with people who want to be part of the solution and not part of the problem. So here's our little grain of sand, as we say in Spain, from the Lovexair Foundation. We've been 15 years breathing life into the respiratory community, although personally, for me, 27 years, as my son born with alpha-1 27 years ago, undiagnosed in Spain, led me on the journey of patient advocacy. But in this last 15 years, Lovexair has dedicated its efforts to developing digital health, hybrid care, attending to people, vulnerable communities, people who don't have equitable access to care. And in recent years, because of the issues we face with climate change and air pollution, we've begun a journey there also to see if we can provide resources to help people identify their issues. So we developed at the end of last year, with the help of clinical experts, many of whom here are ERS specialists, air quality people and public health persons, and patient advocates, an easy-to-use tool to help us identify what problems people might be experiencing in their lung health. Perhaps they don't have access to spirometry or other ways of monitoring their health, but they feel that symptoms and risk factors and air pollution may be having consequences on their health. So Check Air is an online questionnaire. It's made up of some clinically validated tests and additional questions which we know we need to bring in to find out what may be happening with people. Anyone can take the test. We've got it available at the moment in 3 languages, and we then supply a personalized report to that person, and they get a lung health guide. So that helps us to address some of the issues we're facing with misinformation, and also giving some better information to people so they can go to their doctors and have a better conversation about those symptoms or those risk factors which they feel is impacting on their lung health and their wellness. So we also got in the back end an analytical dashboard, and the reason for that is because we want to elevate this project so that clinicians and researchers can help us also to identify trends and insights which may be occurring for specific populations, vulnerable people in particular, younger generations, children, and also the undiagnosed. We've had the World Health resolutions this year, and we know that we must make an effort to improve our diagnostic capabilities and at least start to look at the general population and find out what it is there that they may be affecting their health, and then what we can do about it. So the dashboard gives us a lot of different spectrums on people's health. We include information on COPD, we're including the CAT test. We're looking at asthma as well. We're looking at the combination of respiratory diseases, and we're also looking at those symptoms. So up until a few days ago, we had about 650 people reporting in from different countries. We're happy to see that there's a good mix, 50-50 nearly, of undiagnosed and diagnosed, and we're breaking up into the different disease spectrum. We decided we'd produce a heat map to see if we could analyze some of those symptoms and recognize perhaps some trends, although we're still early days in the growth of this data repository. So we have a high percentage of undiagnosed people already experiencing symptoms similar to those already diagnosed. That's an area of concern, a bit of a red flag where we feel we should be taking action. Then on the number of percentage of symptoms experienced by people according to diagnosis, we're seeing that there's a high burden of symptoms occurring in many of the diseases, and that's another area where we should be looking at. Are those people managing well their disease, or is it worsening quickly? What should we be doing about it? The most relevant symptoms we see here are cough, secretions, and fatigue. We all recognize those symptoms in the medical establishment, but do we need to take further action on those and in some way make those really relevant factors when we talk about screening or early diagnosis for people? We also noticed, sadly, very poor control of COPD in the population, which definitely needs a much better intervention. Again, on the dyspnea severity, we had about 79.4% people with COPD who are showing marked dyspnea, and 40% of the undiagnosed people, which again concerns us. We need to be acting sooner with people. We need to be making interventions that are going to help them manage. Perhaps it's air pollution, perhaps it's other causes, perhaps it's just disease onset from other factors, but we really need to work harder to find out what's going on there. And also, we noticed that the percentage of people who were undiagnosed with slight dyspnea are very similar to people with much more serious conditions. We looked at the risk factors prioritized by country. Sadly, stress, smoke, anxiety, pollen are coming up as high-level factors that people are prioritizing. And the question we had about the percentage of people who self-reported living in high levels of pollution was actually at the very end of the study. So it didn't condition their answers prior to the final question. We can also look at different countries or cities, which means we can work together with clean cities or with countries or with governments, and we can see what's really happening in people's health. And we notice that anxiety and stress are having an impact in different ways on the diagnosed and on the undiagnosed population, which in Argentina, for example, was also quite outstanding. Now, coming together and joining forces to build a global data repository is actually incredibly important. And we can do that from local level up, national level, to global level, because we're all capable of joining in these sort of campaigns and spreading the word. And then we can get data insights which are much more important and relevant for further scientific research. So from Lovexair, we're very happy to facilitate these resources to civic organizations, to medical societies, to institutions, to researchers, and also to governments, so that they can take the necessary interventions they need to make with their own populations and their own communities. And we're happy to provide training for that and social media support. Because actually, without the social media reaching the general public, we probably wouldn't gain much participation in these sort of studies. So these tools and resources become extremely important when we want to tackle this on a global scale. What's next for us? Well, we aim to continue to build a database. We have a lot of organizations who are interested in working with us, including physicians in Mexico. We can give out a QR code. We can do it in the community. We can do it in surgeries. We have many ways of getting the word out, and it gives us a grand opportunity to grow together and face head-on the challenges that we have in dealing with air quality and poor diagnosis in disease. And we also want to get involved with the air quality experts who are very convinced about working on these sort of projects, so that we can do further research. We can cross-reference data from monitoring stations, and we can even add in physiological data from wearables in another level. So for us, the research in the mid to long term is very important, and also the engagement of citizens in the project. So Clean Air, Healthy Lives, or Healthy Air and Healthy Lives, is bringing respiratory health to the heart of the global agenda. And more than 50 organizations happily have joined us, and we've become membership of significant global air health and planetary health alliance organizations as a consequence of taking on this challenge. And we'd like you all to join us, one breath at a time. Promote Check Air in your own area, get it translated into another language, take direct action, help us build a global respiratory health map together, and share the lung health education with your communities and be part of a leading research initiative together. So together we can all deliver on the WHO lung health resources. And I think breathing is what we want to do. Thank you. Can we do the voting, please? Scanning this, please. It'd be great if you could give us your perspective as patient advocates and representatives on how significantly you consider the impact of air quality on respiratory health. So start voting. Thank you. Oh, quite high then. That's great. And I think the next one is, does your organization actually carry out specific advocacy actions as part of its annual projects on climate or clean air? So scan the code and let's start voting. Right, that's also getting better, I think. Perhaps needs a bit of help, so we're here to join you and give the backup that we can. Thank you very much. Let's act.
Thank you for the interesting presentation, Jane. And now I invite Dr. Ghulam Mustafa to present. Dr. Mustafa is a professor of pediatrics at Chakra University in Saudi Arabia and chairman of Helping Hands Foundation, which is a non-profit in Pakistan. He developed a pioneering grassroots model to improve vaccine uptake in underserved communities and works to improve access to pediatric respiratory care. The floor is yours.
So, Assalamu alaikum, ladies and gentlemen. It's my pleasure, pride, and privilege to be in front of this august audience, which is quite diverse from across the world. I'm going to share with you this success story of advocacy, which actually is all of us have got an objective with us, whether it's any organization. Like previously we have thought of like the mothers and the kids care and the air quality, whatever. We need advocacy. So I'm going to talk about this, our field experience of this successful approach. And this is applicable actually everywhere in all policy matters and in all our walks of life. So I have nothing to disclose. We are working in Pakistan and our central area is in Multan, which is exactly between the north and south. And our areas of work are health, education, and community empowerment. Our main focus, me being myself a pediatric pulmonologist, and by the way, I'm also cancer survivor. I was told by the doctor that I have got only 3 months, but it is more than 6 years now when I was told this. Anyhow, so our work is with the Institute of Child Health, where we provide all the diagnostics, consultation, and the medicines, obviously free of cost. And then we have got program for asthma screening in schools, where we have screened more than 40,000 children with spirometry. And Pediatric Lung Association, where we work for the advocacy work. But advocacy work, actually, we didn't start initially. How it started was that our maid, she went on to the maternity leave, but when she came back, she was without a child. My wife asked that, where's your child? She said that he died during labor because of obstructed labor. But why you didn't take the child or you went to the hospital yourself? She said that my mother-in-law didn't allow me to go. And the hospital, a tertiary care hospital, it was only 1 kilometer away, a 5-minute distance from their house. So I was quite shocked that what is the problem? Why they have not taken this girl to the hospital for delivery, and they have lost a child. And later we knew that mother-in-law was not sure that the care is good care over there, or they didn't believe in doctors or their treatments. So we were worried about it. And when we went into the locality, we saw that the children, they were also not vaccinated. Our concern is the prevention, more of breastfeeding, more of vaccination, clean air, clean hands. And we were surprised to see that there were 4 static vaccination centers around that area, and the children were not getting vaccinated. There were 3 vaccinators residing inside that community, a community of around 600 houses, but they were not, around 50%, 60% they were vaccinated only. So free vaccination, and they are not getting it, so we were very much worried about it. What is the problem? Why they are not getting it? So we came to the conclusion that the facilities are there, the water is there, but the people, they are not thirsty. They don't feel like to go. They are not motivated. So we thought of the solution. Well, we have to motivate. But how to motivate? Who is going to bell the cat? And how to bell the cat? That was a question. So we made a plan. We talked to our friends in American Academy of Pediatrics, and then we came up with a program for 3 years. We thought we will motivate the people around in the community. And in that 3-year program, we took 2 girls from the community. They were going door to door, every house, daily around 10 to 20 houses, and they will cover the whole area in around 1.5 months. So they will keep on going from one house to another house. This is just, you see the picture, this was on the newsletter of the American Academy. One pediatrician making a world of difference, but this is afterwards. Initially, it was quite different. The women, the girls, they were going in the house. They were talking to them daily, 10 to 20 houses. They will talk about the issues of vaccination, breastfeeding, antenatal care, and the hand hygiene. So there were 10 messages that they were delivering actually daily. But to our astonishment, we thought we are going to get results in 1 cycle, in 2 cycles, in 3 cycles. But there were 3, 4, 5, 6, 9, 10, and there was no response, almost no response. So obviously we were disappointed. We were depressed and quite disheartened because of, so, I mean, the motivation is not working, so what is the problem? So, but then came a phenomenal change in the next couple of months. So, I mean, 10 to 12 months was not a change, but then there was a change in around 10th or 11th cycle after a lapse of 12 months, 14 months. And then that change was phenomenal. Within 2 months, the figures, they went from 0 to 50%, 10 to 60%, 60 to 90%, and I'll show you in the next slide. But the phenomena that we learned was that the change is actually not a gradual one that will start from the very first month or the second month. Change is actually just like a crop, that where we sow a seed, we water it, we fertilize it, and all this is input, investment. There is no output at that time. But once the crop, it ripens and it is harvested, then there is all the rewards, and then you get all the repayments, and everything is repaid at that time. So if you see just the figures, I mean, for vaccination, it went from 65% to around 90%, and antenatal care, that also increased from 13 to 56%. Breastfeeding, which is always a problem, it went up to 60%. So all the parameters, they went high up, but the change was all in the later part of our efforts. And from there we learned, I mean, this is another. Previously they were having free vaccine and they were not getting it. Here they had to pay for it, and the vaccination uptake was more than 90% in the camp. Here they had to pay. And not only, so this we published in the journals of tropical pediatrics, and this was also taken up by the American Academy of Pediatrics, their newsletter, and in the Pediatrics in Review, and the Family Practice, and also in the International Congress of Pediatrics at the Johannesburg. We had to present this, and then we were invited at Orlando to share our experience. But the important thing is actually, before we conclude, that it is a crop phenomena, it is a crop harvest phenomena, but the different crops, they take different time to harvest. So that is what we have to remember. So as my friend previously he was anxious about that, should we continue with our advocacy or not? So I would suggest that there are certain crops who ripen in just in 3 months, but then there are others who take a year, 3 years, 5 years, 7 years. So it depends what crop is there. And we have to know that advocacy, especially in the policymakers, policy changes, and in the people's behavior, for different messages, they take different time. So that is the thing that we have to be persistent, and that is what our message is, that we have to be persistent. The change comes, and once it starts changing, it is a phenomenon. It's just like high growth, just like a crop. And all the output is there, and one feels satisfied at that time. So we should not be disheartened. We should not be depressed with our efforts, that should we stop it or not. We should continue with our ray of hope. Hope is always there. Sun always rises after the night. Thank you very much.
Great. Thank you, Doctor. Before we go to questions and answers, we'd like to show a short video with some more examples from our network and patient organisations about how they are working on these issues and taking actions in their own community. So can we play the video, please?
Hi, I'm Carlos Pons, Director of the Respiratory Foundation. I'm very sorry not to be able to be here with you today. The Respiratory Foundation is aligned with the main theme of this year, thinking globally, acting locally. Since 2019, we have been committed to protecting the environment through our code of ethics. That's why every year we carry out at least 2 actions to improve the quality of the air that people with cystic fibrosis and society in general breathe. Now we are focused on the creation of a forest in the Sierra de Tramontana mountain in Mallorca, with the collaboration of a forest management company, a hotel company, and a banking foundation, and of course, with anyone who wants to join this beautiful project. We also carry out activities to raise awareness of cystic fibrosis and healthy habits in schools. We want new generations to grow up with these healthy habits incorporated in their daily routine. In fact, we have created a song about healthy habits for children and young people that is proven very popular in schools. So now we are working on an English version to send to the European Lung Foundation. To carry out these actions, we rely on volunteers from some important companies. So through these actions, we not only fulfill our commitment, but bring together some important companies to support our cause and set an example for society. We hope that many organizations take similar actions, and together we can improve the environment. So thank you very much, and enjoy the Congress.
We felt thunderstruck when our 2-year-old grandson got the diagnosis PIBO. Post-infection bronchiolitis obliterans is a very severe lung condition. It occurs very rarely and primarily in very young children. There is no cure. Patients often need regular oxygen and hospital treatment. Diagnosis is effectively assessed by high-resolution CT scan demonstrating the obstructions in the small airways. So the disease is often missed or misdiagnosed, particularly in areas where these advanced techniques are not available or too costly. There is no clear cause for the disease. Thus, we need to raise awareness under physicians and specialist doctors. to develop specific biomarker-based assays that can be applied in low-tech laboratories, and to search for the underlying mechanisms causing PIBO. In just 1 year, parents have gathered over 70,000 euros through different crowdfunding actions. We have raised the Dutch PIBO Foundation to responsibly use the collected money, co-finance research, and create a platform for parents and patients to share their worries, hope, and experience. We are teaming up with 4 pulmonologists from academic medical centers to design a unified nationwide protocol for diagnosis and a national database for all clinical information. We call upon you doctors, leading scientists, and representatives of sister organizations from Europe and the rest of the world to join us to beat PIBO. Only collectively we will have sufficient critical mass to achieve our common objectives. Let us meet and discuss plans. I will wear this t-shirt throughout the conference so you can easily spot me. On behalf of all PIBO patients, I thank you.
Hi everyone, my name is Nicole Haas and I'm the spokesperson of the Spanish COPD Association APEPOC. Since its foundation, APEPOC has been seriously committed to climate change, and in fact we are also part of the European Lung Foundation's monographic working group. Thinking globally, acting locally is our way of working. Our coordinator Juan, a COPD patient and doctor of biochemistry, will tell you more about our latest project on decarbonization and green inhalers.
Hello everyone, I am Juan Traver. I am responsible of the coordination of our regional coordinators and expert patients of the Spanish National Patient Organization of COPD, APEPOC. During the last year, APEPOC carried out many meetings with local and regional political decision makers to explain them the importance of decarbonization and green inhalers. Decarbonization inhalers involves reducing the carbon footprint of inhalers, particularly metered-dose inhalers, MDIs, which rely on hydrofluoroalkane propellants, HFA, that are pouring greenhouse gases. Green inhalers, like dry powder inhalers, DPIs, and soft mist inhalers, SMI, are more environmentally friendly because they don't use those propellants. Switching to DPIs and SMI where appropriate can significantly lower carbon emission and contribute to a greener NHAs and overall environmental sustainability. After all this meeting and thinking globally, acting locally, we achieved the publication of a specific national recommendation guide by the Spanish Health Ministry. Thank you.
I'm Justine Amaïd. In 2023, I founded the French NTM patient organization, MNT Mon Poumon Mon Air, for the NTM pulmonary disease. NTM means non-tuberculous mycobacteria. This rare disease is bad known, so it's underdiagnosed because not all pneumologists know it. Consequently, the prise en charge can be different for patients from a pneumologist to another one. It is an inequality in terms of care for patients. In order to inform pneumologists about the NTM pulmonary disease, to harmonize the prise en charge of patients, and to improve the patient's journey, MNT Mon Poumon Mon Air advocates for a national protocol for diagnosis and care, a protocol dedicated to this disease. The protocol will describe all the aspects of the disease, the symptoms, the diagnosis, and the necessary multidisciplinary prise en charge of patients. Pneumologists will receive this protocol so their patients will have the relevant care and treatment. For these issues, information, diagnosis, and prise en charge, MNT Mon Poumon Mon Air is supported by a scientific committee composed by 10 professionals, pneumologists and researchers, whom I thank very much. As a patient partner, I cooperate with professionals during training sessions for nurses or future doctors in order to help them to better understand the disease and the patient's daily life. All these actions are necessary because before 2023, there was no advocacy for the NTM pulmonary disease in France with a patient organization. Together we are stronger and we never give up.
Mä oon Tanja Sointu ja mä työskentelen kokemustoimijana Hengitysliitossa. Hengitysliiton ilmasto-ohjelmat kannustavat toimiin, jotka ehkäisevät ilmastonmuutoksen aiheuttamia terveyshaittoja. Hengitysliiton 2 ilmasto-ohjelmaa ovat viime vuosina tarjonneet tutkittua tietoa ilmastonmuutoksen vaikutuksista luontoon ja ihmisiin, fokuksessa sään ääri-ilmiöt ja niihin varautuminen. Ensimmäinen Sitä on nyt ilmasto-ohjelma sisältää suosituksia päättäjille. Suosituksissa painopiste on ollut ilmastonmuutoksen aiheuttamien haitallisten terveysvaikutusten torjunnassa. Toinen ilmasto-ohjelma on täydennysosa. Tämä uutta ilmasto-ohjelma, joka julkaistiin viime vuonna, päivittää tutkimustiedot ja on opas ihan jokaiselle ilmasto- ja sääriskeistä, ilmanlaadusta sekä luonnon terveysvaikutuksista. Hengitysliitto jäsenineen on viestinyt ohjelmista sekä jakanut niitä yleisölle ja päättäjille. Lisäksi kaikki halukkaat ovat päässeet mukaan talkoisiin. Kun ilmasto-ohjelmista viestiminen aloitettiin, Hengitysliitto jakoi samalla ilmaiseksi siemenkiekkoja. Kiekko oli valmis männyn istutuspaketti, jonka kuka tahansa voi helposti istuttaa maahan. Hengitysliitto jakoi männyn siemenkiekkoja jäsenyhdistyksillemme ja jokaiselle kiinnostuneelle erilaisista tapahtumista ympäri Suomen. Kiekkoja jaettiin yhteensä 10 000 kappaletta ja jokaisessa kiekossa oli useampi männyn siemen. Tiesitkö muuten, että Suomessa on arviolta yli 3 miljoonaa saunaa? Saunojen määrä suhteessa asukaslukuun on maailman suurin. Saunoja on jopa enemmän kuin henkilöautoja. Moni saunoista lämpiää puulla ja pienhiukkaspäästöjen vähentämiseksi Hengitysliitto on konkreettisesti eri tilaisuuksista yhdessä vapaaehtoisten kanssa opastanut ihmisiä siitä, kuinka puuta poltetaan mahdollisimman puhtaasti. Näin kaikki voivat auttaa ehkäisemään puun pienpoltosta johtuvia ilmanlaatuhaittoja ja parantaa hengitysilman laatua. Tässä ohjeet, miten puuta poltetaan puhtaasti. Hengitysliitto on tavannut myös poliittisten puolueiden edustajia ja paikallisella tasolla virkamiehiä. Vaikutimme valmisteilla olevaan kansalliseen ilmastonmuutokseen sopeutumisen ohjelmaan ja olemme iloisia siitä, että sinne saatiin mukaan suunnitelma helteen aiheuttamien terveyshaittojen ehkäisemiseksi. Tämän lisäksi liitto on päässyt suoraan vaikuttamaan maan suurimman kaupungin Helsingin ilmanlaatuohjelmaan. Saimme sen seurauksena kutsun myös alueellisen ilmastonmuutokseen sopeutumisen suunnitelman työpajoihin. Olemme järjestäneet asiantuntijaluentoja sekä verkossa että läsnäololuentoina. Työmme ilmastonmuutoksen haitallisten terveysvaikutusten ehkäisemiseksi ei ole meillä erillinen projekti, vaan on nykyään osa jatkuvaa arkityötämme. Ajantasaisen tieteellisen tiedon popularisointi on tärkeä osa sitä. Jatkamme vaikuttamistyötä terveyden edistämiseksi ja hengityssairautta sairastavien elämänlaadun parantamiseksi. Tässä kuva jäsentemme yhteisestä luontoretkestä. Mä olen itsekin kokemustoimijan roolissa menossa mukaan Hengitysliiton järjestämälle luontoretkelle kertomaan omista kokemuksistani. Meillä on suunnitteilla jäsenillemme ryhmiä, joissa hengityssairautta sairastavat voivat matalalla kynnyksellä jakaa toisilleen vinkkejä, kuinka itse toimia omasta arjesta luonnon hyväksi ja samalla saada terveyshyötyjä luonnosta. Uskomme, että konkreettinen tekeminen, kuten puunsiementen istuttaminen tai polttopuiden oikeanlaisen pinoamisen opettelu yhdessä, vahvistavat luontosuhdetta ja sitä kautta motivoi myös tekemään ilmastotekoja. Kun pidämme huolta luonnosta, se pitää huolta meistä. Lisätietoja ilmasto-ohjelmistamme löydät Hengitysliiton verkkosivuilta. Kiitos!
That's great. Thanks to everyone who took part in that video, and hopefully it will give us some inspiration as patient organisations to see what other groups have been getting up to. We're now going to just do a quick 10-minute question and answer session for our two speakers here. So if anyone's got any questions, please raise your hand. There's none online, but if anyone's got a question here in the room, our two speakers will be delighted to answer. No, there's no questions online. Louise, do you want to?
Well, all kinds of environmental issues here, and I think it's an eye-opener, I think, for the future for us all, that we have to be very eager to improve everything, and it's very nice to see that so many organizations are into this climate issues. And yeah, well, I don't have a real question, but just a short summary.
Sorry, we have a question from the floor there.
Hello? Oh, sorry, it is working. Harry from Lung Foundation Australia. Just got a question for Dr. Mustafa. You mentioned the cycles and the repeating of those cycles. Was there a difference between each cycle? Did you do anything differently, or was it the same workers attending the homes with similar messaging to reinforce those?
It's working. Yes, it's working. Thank you for asking this question and clarity. Actually, we did not change anything. The curriculum was the same. The only thing was that after every 2 months, we used to reinforce our girls with the same messages that might be over the passage of time. They have gone with some change in the messages. So we wanted the message to be consistent. But what I feel at the moment, looking back retrospectively, is that the change was because these people, they were going in every house, door to door. These girls, they were going. So they were giving the message to one house, the same message to the next, same to the next. So the people initially, obviously, there was a bit of change, like say from 0 to 1%, but not to the level that they could act upon it. So, and once they would go back to their houses, these people who are neighbors to each other, so they will also talk to each other that they came and they were saying like this. Somebody would remember one message, another one would remember another message. So they will later would exchange. But slowly in every cycle, the level of message, a level of understanding was increased every time. So it's say like the just water, it boils at 100 degrees. So till 80 degrees, it will not boil. So similarly, I think, so it was getting hot, hot, and hot. So they were taking the messages, but the level of action, the level of boiling, that came later. And once it came, so the whole community, it all boiled, just like the water. I think that was the reason. But we remained consistent with the messages because the messages, they were well, we had a 6 month of prior making the messages and to validate them that these messages are right and we have to deliver them in a right way, like for breastfeeding, for hand hygiene, for vaccination, all the things. So we were clear about it, that we do not need to change it. So we were consistent and patient. although depressed, but at the last we found the solution, or the endpoint was fine, and we were satisfied that approach is fine.
Thank
you very much.
So it was like the community was supporting then itself as more people took the action.
I think so, that eventually it came to the point.
That's great. Thank you.
Thank you very much.
I can ask.
Go ahead. Oh, I can see.
There.
Oh, there it is.
Thank you. Lilia Jean from France. So you spoke about the change of inhalers, and I would like to know the ELF position and maybe the actions. The patient is not guilty to use dosimetered inhalers, and there are many laboratories that try to make the inhalers safe, dosimetered also. And sometimes in our country, for example, we had the Social Security document ordered to change the dosimetered to powder inhalers. It's maybe very serious problem for treatment adherence. So what we can make with new inhalers, how we can act. Thank you.
Do you want me to comment on that, Liam? So Pippa here from ELF. So Lilia, our position at ELF is that the patient must have the best treatment, the right treatment for them, but we obviously are supporting changes in medication treatments that are greener. So we're obviously, but to the best needs of the patient. So I think 100% we want to give green healthcare options, but not to the detriment of the patient. So, yeah.
Great answer. Can I? In this session, I'm Eleni. I'm from Greece. I'm a PF, pulmonary fibrosis patient. And in this session, in the previous, we heard a lot about prevention, about air pollution, about all these things that damage our lungs. Lung diseases are increased and will be increased in the future. I was thinking, what we can do for all this. I think that education about lung diseases is very crucial issue, and we have to educate our children, not educate the patients, but we have to begin the education from the school. We teach to our children about mathematics, about a lot of things, but we don't speak how to live or to live healthy. That is a very important issue to prevent the lung diseases. So I think that we have to do a plan, to do a strategy of education globally to prevent and to teach to our children how to live better, how to avoid smoking, or all these habits that can create long problems to them and stop their lives in a way that no one can do. This is something that I think that we have to consider about very carefully. Thank you very much.
Totally agree.
Yep. A point well made there. I mean, obviously, ELF have been doing their Healthy Lungs for Life schools program. Shane has been teaching, and some of the other people who joined via video have done projects about education aimed at children. But I totally agree. Like we have to start thinking about lungs for life. From childhood to adulthood. Would anyone like to comment on that points as well?
I think, is it working?
No.
Yeah, no.
I don't know.
Okay. Yeah, I think it's really important that we really focus on health education in the younger years. There's clearly not enough information going out there, but now one of the advantages we saw with this campaign, Lovexair, is that we could come together with much more activist environmental civic organizations and institutions. And actually, for us, we become very endemic sometimes in the patient world. We think that our information is getting out there, but it's not. So our engagement with complementary network of stakeholders who are just as concerned as we are about health and environment is a natural ally and partner for us to expand our outreach through social media, through any kind of networks where we can get information through. Although it seems like it's going to be easy to get into schools, it really isn't. We have tried, and they're very restricted in their curriculum and so on and so forth in their time. But I think we have to look at the alternative channels of communication, and we can always do that in public places with complementary networks. We must get more corporate engagement. We must find other partners, but it's really important that we do educate in the early years, because we could do so much more work in prevention like that.
The last question from microphone 2.
Thank you. Yes, my name is Fraser Goodwin. I'm the policy coordinator with EFA, the European Federation of Allergies and Airway Disease Patients Associations. Quite a mouthful, but there we go. And my question is about the Lovexair project and the database that you presented. I think it's a really great potential support for advocacy, but really, have you developed the tools that would be really useful for people to harness that information and translate it to campaign tools, not just information tools, for both the local, the national, and for people like myself at international level to really harness that information?
Well, we met Dr. Noda quite a while back, actually, during the pandemic, and we were having conferences on air quality impact. So we also met Rosamund, and we worked on a film, Breathe Mum, which was launched last year in Barcelona. It actually ended up in the WHO in Colombia. We got invited back. So the campaign materials, we worked really hard on the content, and we validated content with a lot of different specialists. It takes a lot of time, actually, to build up that material. But then when you get in a mindset and you're getting certain people collaborating, you can continue that dynamic, and it's really important to do that. So, like we've said, there's too much misinformation. We really must have good content and attractive content. It has to work in TikTok. It has to work in Instagram. It has to work in all these multiple channels that different segments of society are using. And of course, it has to work in local populations. So we were asked to produce a proposal for the Ugandan government recently for this campaign, but we already started talking with local agents, because it isn't just about our language. It's what fits with the people there, what works in their community, what kind of language are they using, what kind of imagery, etc. So it's very important that we adapt to communities, to different nationalities, to different cultures, because that way we're going to be much more effective in our communication.
Thank you, yeah. Well, yeah, I mean, we work on both prevent and care and climate change across our community, but having a tool readily available, a toolkit ready available that harnesses your data would actually be very, very useful, and we'd appreciate it.
Very important. We put it in 3 languages, and we're already getting requests to go out, but these working together, actually, you can be much more efficient and much more dynamic and also more creative. So I think it's important that togetherness across multidisciplinary team for communication materials, and that way we can make it work.
Thank you for all your questions and all the insights from the panelists. And we are now going to break, but first of all, we want to make a group photo, and afterwards there's time for lunch. I think everybody is up to it. But before we do that, I want to explain that your tables will change for the afternoon discussion groups. You have been allocated a table when you were in the beginning of the sessions. If you are not sure which table you are on, please check with the ELF team. And when you come back after the break, please sit on your allocated table so we can quickly get on with the discussions. You will also have two new chairs for this afternoon sessions. So on behalf of Liam and myself, many thanks for your participation and your questions and all the nice presentations. Please come and join the photo now and then enjoy your lunch. We will come back in an hour, at 14:40, so I hope you will all manage to eat something in the meantime. And now I will hand over to the ELF team or the photographer, I don't know. Yeah, okay. Thank you.
Okay, welcome back. We hope you had a good lunch and had time to talk to each other and make a big exchange to each other. And my name is Marion Wilkens. I'm a patient of the alpha-1 antitrypsin deficiency, which we heard we have to learn it more in the morning. And I'm leading the organization Alpha-1 Germany for now more than 10 years. And it's an honor for me to co-host this afternoon session and to introduce you now to my co-chair on my left side, to Luca. So Luca Roberti.
Thank you.
Your turn.
Hello, everyone. My name is Luca Roberti. I am a patient with sleep apnea, and I'm also founder of Italian Sleep Apnea Patient Organization. I am also member of the ELF Sleep Patient Advisory Group. This afternoon, we will hear from our final speaker, and then split into breakout discussion group to share your experience and ideas on tackling global challenges. Before we introduce our next speaker, let's briefly check in with our online audience. We don't have any comments. No. You should all now be sitting on the table to which you have been allocated. If not, ELF staff members can help you to find your table. We will tell you more about how the breakout groups will work in a moment. But first, I am delighted to introduce Dr. José Luis Castro. José served as the World Health Organization Director, General Special Envoy for Chronic Respiratory Diseases, leading global advocacy to elevate lung health on the international agenda. Welcome, José. Over to you.
Thank you very much, Luca, for that kind introduction. And good afternoon, ladies and gentlemen, friends, colleagues, and patient leaders. I want to begin not in Geneva, not in New York, but with the patients who remind us why we are here. I think of Sandra in Australia, or Nancy in Costa Rica, and Redsti in Kenya. Just three of the voices that you heard earlier today. Each describe what it means to wake up every day with lungs that cannot find enough air. For them, an inhaler is not a convenience, it is a life itself. For them, clean air is not a luxury, it is survival. So when we speak of the lung health resolution, I want you to see their faces. Because this resolution is not about paper in Geneva, it is about dignity, breath, and justice. This May, at the World Health Assembly, governments adopted the first ever WHO lung health resolution. For the first time in WHO's history, lung health has a comprehensive global mandate: prevention, diagnosis, treatment, and long-term care for asthma, COPD, tuberculosis, and many other respiratory diseases that too often remain in the shadows. This means that lung health is now firmly placed in the world's agenda, no longer invisible, no longer the Cinderella of global health. But the resolution is not the finish line, it is the starting point. Just this Thursday in New York, I attended the UN high-level meeting on non-communicable diseases. This is a fourth such meeting. And there we saw a political declaration that, for the first time, named chronic respiratory diseases explicitly. That was a breakthrough. But we also saw how fragile progress can be. One country blocked the consensus, and the declaration will now go to a vote. And the lesson is clear. Words are never enough. What matters is what happens next. What matters is whether commitments become clinics or medicines and healthier lives. As I say often in global forums, words are beautiful, but not enough. Words must become oxygen. The great Spanish poet Antonio Machado once wrote, "Traveler, there is no path. The path is made by walking." And the lung health resolution is our path, but the path will not walk by itself. We must make it real, step by step, country by country, clinic by clinic. So what does that mean in practice? The resolution calls on governments to integrate lung health into primary care, to ensure universal access to essential medicines, to reduce exposure to tobacco smoke and polluted air, to strengthen surveillance, data, and research, and to build a health workforce equipped to diagnose and treat early. It is comprehensive, it is ambitious, and it is long overdue. For patients, what will change? No child missing school because asthma medicines are out of reach. No mother forced to cook over open fires that scar the children's lungs. No family choosing between food and a month's supply of inhalers. This is what lung health for all looks like. But my friends, let's be honest. WHO alone cannot deliver this resolution. Ministries of health alone cannot deliver it. It will be delivered, or it will fail, depending on what happens in rooms like this one. It will be delivered in patient groups. It will be delivered if patient groups keep pushing, keep mobilizing, keep reminding leaders that the right to breathe is non-negotiable. And it will be delivered if clinicians, researchers, and advocates unite around one simple principle, that breath is life. I want to close with the words of Mahatma Gandhi, who said that action expresses priorities. And if we truly believe that every person has the right to breathe clean air, the right to affordable treatment, the right to a life not cut short by lung disease, then our actions must prove it. The lung health resolution is not a gift, it's a responsibility. And to the patients in this room and around the world, your voices carried us this far. Now we must carry your demands into parliaments, into budgets, into law. So let us leave Amsterdam not with applause, but with resolve. because the true measure of this resolution will not be counted in Geneva or in New York or in Amsterdam. It will be counted in lives extended, in families spared, and in the millions who, thanks to our work, will finally be able to take a deep and troubled breath. Thank you very much.
Thank you very much, José, for this wonderful overview of the WHO strategy to improve lung health across the world. We will now move to our fifth breakout discussion session to dive deeper into these topics. There are two breakout sessions this afternoon. The first to explore what the WHO lung health resolution means to our patient communities. We will come together for a short plenary discussion and a chance to hear José's insights on our discussion. We will then have a short break, and the second session will focus on what practical steps your organization could take going forward in response to the resolution. Marion will now explain how the breakout discussion will run. Thank you.
Yeah, for our first discussion, we are going to think about what the lung health resolution means for us patients, as well as for our organizations and the community around it. And we will now try to address the points that we have to give into the World Lung Resolution. We have some examples. There are some examples of things that your organization could do for the ELF advocacy team and space for you to write your personal action plan. And there's also a breakout group for attendees joining online too. I will give the instructions for the breakout session for the online group at the beginning. So, all attendees online, you will have to leave this live stream and join a Zoom meeting for your group discussions. This is only for those who are registered in advance. If you just jumped in today and you're not registered, you cannot take part in the discussion. But you can rejoin then in the live stream at 50 hours, 5 minutes in the plenary session back again. The Zoom link has been emailed to you in advance by Claire Williams and is available in the live stream as well. Join the Zoom where Claire will be waiting for you. When you are in the breakout room, Claire will lead the discussion and you have 30 minutes for the discussion. Please come back to the live stream. As I said, 15 o'clock and 35 minutes. And you can start it now. So the attendees here in the room, you have on every table, you have a facilitator who will lead the discussion. So maybe the facilitator on your table is just raising the hand, so that's clear who is the facilitator. Ah, lovely. And you have also a note taker on your table, and a special wish, first of all note taker, give me a wave. And the second, please write it in a written language which we can read, please. And so the note taker will take everything from the table which is necessary to be written down. And we will catch up with one current action identified from each of your group during the plenary session, so that you tell us what you would like to share with us. This session will focus on what the WHO resolution means to our patient community and how they are responding. At the end of the session, we would like to have, as said before, a selection of one current action that you have discussed to share with a wider group. So write this into the sheet of paper on your table to be shared then afterwards in the plenary session. We will let you know when you are halfway through, and again when there are only 5 minutes left. So we will take care of the time, be sure. ELF staff will coming around and collect the papers you have done for us. So please remain seated after the discussion to listen to the plenary session then. Okay. So you can start now.
Welcome back, everyone, and I hope you enjoy the chance to hear each other's experiences. We will now share some of the action you have identified that organizations are currently involved with. I read the table 8, raising awareness.
That was an easy one. I've got a longer one on table 2. Push for better protocols, better referrals, pathways and guidelines for earlier intervention and diagnosis, faster reaction times, pattern noticing, establish red flags, advocacy, testimonies, interventions from patient organizations.
Okay, from table 9, ELF. From table 9, ELF toolkit to support understanding. José, if you have any comment about this.
Yeah, I'd like to comment on the first one that you mentioned about raising awareness. And I think that it may sound very simple, but it's such a powerful it's such a powerful process when you're able to raise awareness about these diseases, because the public at large has a conception of what they mean and may be different from person to person. You may mention asthma, and almost everyone knows or suffers from asthma or knows somebody who suffers from asthma, right? But then COPD, it's more complex in different languages. It's a totally different acronym, and the symptoms are different. So when we raise awareness and illustrate the lived experiences of patients, and then people recognize what it is, what the disease is like. And even those that may be living with the disease or the symptoms and haven't yet gone for to seek diagnosis and medical care will be encouraged to do that. So I think the raising of awareness will serve those two big purposes. One, to educate the public at large, but also those who may be affected and need to get care.
Yeah, absolutely. Awareness from every side we can get. I've got a point from table 6, and I think I need some help from... So what I can see from the notes from table 6, you have done a lot, and you can see the brains are working, and it's getting warmer here inside because the brains are working. But I cannot read the sentence quite good. So outing sounds getting patients together?
Hello. I'm Emily. Yes, it was about empowering patients with knowledge, getting patients together to talk amongst themselves, not just being spoken to by a consultant or a doctor. So empowering them with knowledge, having a good patient advocate who's knowledgeable, getting them together, and basically with that knowledge working from the bottom up, and being passionate and taking it, you know, as high as you can get to government and politicians, and getting laws changed. I mean, I went to school and people were smoking on the bus. When I was young, we changed that. We stopped smoking on airplanes. We can surely change big things that are hard to change. And I think that's what I was trying to say.
Yeah. It's perfect. It's really perfect.
Absolutely. Thanks. I think you are the most powerful ambassadors, and I think that in getting your voice out, we've been throwing statistics at decision makers, you know, for years, and publishing papers, and the figures are immense, and when we read those in scientific circles. But when a patient goes and meets with a decision maker, when a patient goes and shares their stories, as we saw in the videos of some of you who participated, that is so powerful. And you will always remember that person no matter where you go, and their story, that brief encounter, is a very powerful message.
Okay. Do you read the next one?
Okay. Online. Nobody join together with other organization to push the change, especially by
rare disease.
Rare disease, okay.
Stigma is?
In numbers.
Numbers, yeah. Oh, it was the online group.
Online, yeah.
So, hope we said it in the right way. Join together with other organizations to push for change. That sounds good for me.
Yeah. Definitely. In unity, you have more strength.
Yeah, absolutely. And Table 7 would like to tell us, we used the awareness days to advocate and speed the message of the importance. These days are great to go viral. More people are reacted. Awareness is the first step towards advocacy. Very well said. For you.
Okay. Huge gap exists in access that they lead to inadequate care of so many. These gaps are in location, education, and mental health, communication, and delivery.
What was... There are huge gaps exist in access that lead to inadequate care for many. These gaps are in location, education, mental health, communication, and delivery. Yes, the access to the huge gaps that exist in the access to care, to medicine, and also to resources.
Table 3 sent us a critical issue. It doesn't mean anything to the patient community right now. They are not aware of it yet. So I think you should comment on that.
The resolution, right?
Yeah.
I think, yes, and this is one of those first processes that we have. I remember shortly after the resolution was adopted, I spoke to that group in the back from Colombia and Peru, and had a conversation with colleagues in Latin America to explain what the resolution meant. And in this forum here, I mean, speaking to you and your organizations to shed light on what the resolution means and how to use a resolution as a tool. Sometimes you don't need to know all of the different components, but just in meeting with a minister or meeting with a decision maker, you invoke that resolution. That is a resolution that exists and that lists the commitments that the government made. So knowing the existence is important, but also even better understanding what are the components, and then through exercises similar to this one here, where then we go into more details and and showing more granular, more detailed examples on how to put it into action will help spread the word, will help other patients around the world then learn how to use it and to turn those words into action.
Yeah, and now it's our case to bring it outside this room. Yeah,
exactly.
From table 5, lung health care should be part of regular primary health service, creating awareness and education.
Table 13 also says to join together across Europe to make it illegal to sell flavored vapes. Absolutely. The key message is to join together strengths and solidarity.
Absolutely. I think these are the threats, to health and especially to children. So the more stronger we are in advocacy against those harmful products, whether it is air pollution or vaping or tobacco smoke, we will be reducing the risks that make us sick, that make our children
Absolutely. Sick. Absolutely. And table 12 mentioned in the resolution text, the word diagnosis need to be dear and not just implied, and the resolution must explicitly call for the findings that is necessary to achieve its aims.
Right, that's a... the funding to support. Absolutely, I think that the first step is the recognition of the issues, recognition of integrating lung health, and I think that gives a mandate that provides a legal document from which to act. From there comes the operationalization of this document and how this vision is then put into an action plan. And that action plan requires resources, money, requires people also to make it happen. And it requires also guidelines to help implement it, country by country. But it begins first with that recognition which the resolution provides. You then have tools to press for resources, and both human resources and financial resources.
We might not get through every point because we have only 4 minutes left, but here are some comments more. Quality of air. Oops, Frank. It's your sentence. Quality of air, say what doing to help patients with lung disease? Emergence?
Absolutely. I think who is the person who wrote that?
I think it is table 6. It's Frank and Maxime. See? No? Okay, maybe you read something else out of it. Oops, sorry.
No, right.
It's an important point. That's why we wanted to understand what the message, because only the quality of the air that we breathe, and especially for those of us who are affected by a lung disease, is even more important.
But in any case, we can read from this sentence we still have here that collaborations is necessary for all of us to get further on and have a strong network like we have today here. So I think that might be some conclusions we can put together from these exercises, that we are a strong community if we want, and we can do lots together.
Absolutely. You are a powerful community, and you have a powerful voices that when you elevate it, it creates action. I think you, as I said in my remarks, it was your voices that have gotten us here. It got this long health resolution at the WHO in May. In July, it got the Economic and Social Council of the United Nations recognizing chronic respiratory diseases for the first time. And then there is a political declaration that will be adopted by the General Assembly. So it's been a momentous year for chronic respiratory diseases. And it happened because of the advocacies of groups like yours, country after country, that have prioritized this issue. Now, the next step is translating those commitments, those global commitments, into local action plans that actually help you and that help those who are affected and prevent those who will get sick if the air is not clean or people continue to smoke.
Absolutely.
Okay. We move. I would like to thank the group facilitators and the note takers for their support. I will now bring this plenary discussion to the end. We'll now take a short comfort break and we'll come back at 4 p.m. for the action planning breakout session. For the online attendee, please use the same Zoom link for your second discussion group. The live stream will return at the plenary session at 4:40.
And then we plan the action.
Okay, Edward.
We start. Hello. For our next discussion, we want you to explore what practical steps and action your organization can take going forward.
Hello, how are you? Nice to see you.
Try to come up with some concrete action points that could be taken forward.
I was the Vice President as well. Hello.
Would
you mind quickly?
I'll come back in 5 minutes.
I think we have José in our
okay.
speech.
We
here.
start again. Sorry, José.
Perfect.
Thank you.
Thank you. Okay, we start again.
Yeah. Not working. Yep. Maybe we should add, because we have one from the online audience telling us a story. The power of the collective voice, for example, ELF bronchiectasis patient advocacy advisory group members from the United Kingdom of Great Britain attending ERS Congress virtually today. And I have been surprised by how many shared experiences there were among people with bronchiectasis from different countries and backgrounds. While my journey is unique, the core challenge, like the burden of daily physio, the fear of exacerbations, or the frustrations of invisible symptoms were almost universal. The reality, discovering this shared experience transforms a personal struggle into a collective one. It's a surprise to see how powerful it is when the collective voice speaks up. A single patient's feedback might be noted, but the consolidated feedback from a PPG can change the wording in a guideline, influence the design of a clinical trial, or shape a new information booklet for thousands. I think this is what we are thinking of.
Okay. Now we introduce the second breakout room discussion. For our next discussion, we want to explore what practical steps and actions your organization can take going forward. Try to come up with some concrete action points that could be taken forward. There is a checklist with some ideas of local, national, and global actions to help inspire you and space for your note, your personal action plans, and a reflection from the day. You'll be able to take this away with you at the end of the event. All online attendees, please leave the live stream, enjoy the Zoom meeting for your discussion. This is only for those who registered in advance. If you have just joined the live stream today but did not register, I'm sorry, but you cannot take part in this discussion group. But you can rejoin the live stream at 4:40 for the plenary session. Please use the same Zoom link as before for your second discussion group. It is available in the live stream platform. Claire will lead the discussion. Come back to the live stream at 15:35 for the plenary. For the attendee in Amsterdam, for those you are here in Amsterdam, you should be at the same table you were seated at the first discussion. Your facilitator will lead the discussion and note taker will record your input. As before, we will be asking each group to write one key action on the paper. This will be taken forward to the plenary session. We will let you know when you are on halfway through and when there are 5 minutes left. Please remain seated after the discussion for the plenary session. Okay.
So have fun again.
Okay, we start.
Welcome back, everyone. Hope you enjoyed the session and you have now lots of ideas for us and for yourself for further action. And looking at the feedback, I would like to start with table 8 because I don't know what it is. Act locally, be a dung beetle. What is a dung beetle? Could you explain, please?
I'm an example of a dung beetle. My name is Anna, and I am part of the non-tuberculosis mycobacteria patient care UK group. And I'm an artist, so often I see things visually. And we were just talking about how to kind of collect a holistic or multiple approach kind of awareness and connection. And I was thinking about there was me, and then there'd be Fiona, and then there'd be a few of the other people and the GPs, and how we kind of rolled this big shit uphill and tried to make sense of it. And that was it. It caught on. But if you can add to its meaning, it's to try and sort out what all the chaos is.
Thank you. A dung beetle is a little beetle that pushes a small thing that gets bigger and bigger and bigger. Poo, as she said. Pushes it backwards.
Very good. Luca, what?
Okay, with table 9, the message is one voice, one message. Advocacy, awareness, knowledge transfer, peace support. Accessibility, working collaboratively is key, is the key.
José, do you have any comments there?
No, absolutely. I think the issue of collaboration was raised here, and I collaborating with different sectors, with different organizations. Again, I think when we step outside of our area and involve others, we're building allies that will help advance our, the issue of respiratory diseases. It's so important to expand the circle, to expand that network of organizations and friends that will amplify your voice.
This is also what is told by, there's no table number, but set up a task force at national level endorsed by ELF to build a roadmap to meet the main priorities of the resolution.
I think that's an excellent idea. I think that having an institution behind also gives it a platform to share what you're doing, what you are trying to accomplish with the politicians. And that brings me to a question that comes from Table 7 that says, as a national organization, ask a friendly politician, who is already involved and has a commitment to ask a question in Parliament, to bring it to the Parliament and put them on the spot. I think that's an excellent way to put it on the record and also put it on the agenda of the Parliament.
Mm-hmm.
We have one question.
Just to reinforce what you were just saying, not just ELF, but all umbrella organisations should come together and unite to create that roadmap or that joint statement.
Perfect. And Table 3 says ensuring top-down actions are taking place as well as bottom-up actions. And I think this is really necessary to have.
Okay. From the online, the message is we need to raise awareness of lung disease among clinicians plus decision makers. To do this, we need big data, disease registers, individual patient stories, education for clinicians, clinician support for ELF is invaluable.
Absolutely. Again, the importance of having data and the importance of having the stories of patients and using this information to share with clinicians and with other friends. I think don't assume that sometimes we assume that because there is a clinician or a doctor that they know about asthma or COPD and that they're well aware, and that's not always the case. And we know from tuberculosis, for example, that in just a few years ago, there were patients in cities and the doctors didn't know that it was tuberculosis. They thought tuberculosis had been eliminated, a long time, but it was recent outbreaks and advocacy and sharing information by patients that put tuberculosis back on the agenda again, and in the medical school curriculum, in the politicians' agendas.
And this fits to Table 11 because including lung health parameters as a part of a standard medical checkup. Yes, really, good idea.
Exactly, and also there are about 90 countries in the world that required mandatory health checks for employment. And the lung function should be included in those checks as well. And that's a part that your organizations can also help, advocate. It's an easy win. It's already in the legislation. It's just adding one more test to know the lung function.
Okay, from Table 2, encourage patients to share their experience with local politicians. Sometimes people don't understand what they cannot see. Medical routine and equipment, for example, visual impact on living with lung condition, and the easy impact on local people.
Maybe Table 13 is something for you, José.
Table 13, umbrella organizations to create a joint statement that they commit to amplifying the lung health resolutions and actions. I think that's what you raised earlier, right? Absolutely, them coming together and behind a common message carries tremendous weight. Not only in your country, but around in the region and around the world, amplifying the same message and asking for the same recognition for chronic respiratory diseases.
From Table 5, awareness and education by distributing the resolution of WHO as a call for action to gather as many society organizations to build up a network of support and promote a strong network and promote the resolutions. Taking an advocacy for patient rights and health management to the next level.
Exactly, and working with advocates, sharing strategies and sharing information on how each of the points in the resolution are operationalized, how each of those points are then translated into action at local level. But sharing those strategies is a very important way to make this happen.
And table 4, hopefully I interpreted it in the right way. Priorities based on, I don't know the word, maybe you can help me. Based on analyzers have to be developed for what patients need, such as accessibility, hard word for me, for all that can be communicated via patient organizations to policymakers. Any comment on that, table 4?
All good? No, you've got it right.
I got it right. Perfect. Thanks.
From table 6, closing the gap between the abstract WHO lung health resolution and the patient day-to-day life at the bottom. Task for patient organization to join education to bridge gap.
I think, if I understood the question correctly, is translating the language and the resolution into actions and into examples of the lived experience of the patients to show the public and to show policymakers what has to be done.
Table 14, we need your help. Table 14, we see here points 6 to 10 of the health resolution will be taken back to
other organizations. We will ask our boards to promote.
Yeah, please explain.
Yes, I would like to explain it. It's 6 and 10, and this part of the resolution should be explained in sexy language, as we determined, to a broad audience, and especially on social media, for instance, TikTok, to reach out the youth, but also reach out people who are not as health literate and do not have the high social economic standards that most of us have here. So we'd like to take that on, including the resolution in a whole, to our boards, to our organizations, and we like them to relate that in the social media to this broad audience.
That's a great point. I think that using the modern tools of communications to share the information and to do so in a simple and attractive way to reach the younger audiences, to reach also what everybody seems to be using more and more, these new tools of communication.
We need lots more languages than only English and others.
That's right.
We need the language of the young and the old ones, and yeah, absolutely. Yeah, thanks once again. We may not have given all the tables the possibility, but we will have later on a summary report by ELF about today's discussion sessions and share with you, definitely. And thanks for the facilitators and note takers. The written form is quite better in the second session. Thank you so much. And yeah, now it's time that we take the action together, and we will bring it now, this panel discussion, to an end. But I would like to introduce the next speaker. Although the ERS Congress 2025 is just starting, we are already making plans for next year. it's my pleasure to invite to the stage Professor Hilary Pinnock. Hilary chairs the Educational Council of the European Respiratory Society, and it is overseen the program for the ERS Congress 2026. And I hope we as a patient and as a patient organization representative will be included. Hilary, I'm very happy to have you here.
Thank you very much indeed. I am delighted to be here, and I'm going to pick up on the very words you used at the end of your summary there about action together. So that's what this is all about. So ERS congresses have always had themes, but you will be forgiven for not noticing them until recently. I actually looked them up to see what they were historically, and most of the time I couldn't find any reference to it. But over the last couple of years, we've started to have a theme that we've tried to develop into something that hopefully everybody at the Congress notices. Do you remember last year, those of you who were here, it was about humans and machines and getting the balance right? Hopefully you've not missed that this year it's about respiratory health around the globe. And it's next year we're already thinking ahead to, and it's called United for Better Breathing. And I'm really pleased to have the opportunity to tell you a little bit about what was in our minds. If you just take that phrase, United for Better Breathing, partnership between patients, clinicians and researchers, there are some words that really stand out, don't they? It's working together, it's united, it's partnerships. And the suggested themes underneath, the sub-themes underneath this, but you can think more broadly than that if you wish. There are three that they've suggested. One is about co-creating care. This is about individual patients working with individual clinicians. So it's about working together as equal partners and empowering patients to shape their own disease. Now, I know I'm preaching to the converted here because you are all shaping your future and the way your care is managed. But for many people, that's much more of a struggle. And how can we empower patients to do that? Please help us with that. The second one is about listening. Listening and identifying what the unmet needs are. And I think I've heard a few of these coming out in the discussion today. So we want to work together to listen and to hear the priorities that matter to you so that we can make our Congress next year focus on some of these key issues. And then discovering together, supporting the science, supporting the research, and I've already spoken to several people in this room who are supporting some of the research that I'm involved in. So working together to identify the gaps and then to do the research to discover the solutions. So we want to collaborate. These ideas, because we're doing it together, many of the symposia historically have come from the assemblies in the ERS, and we've asked, very politely asked, if you might do a little video for us. We want to kind of expand that model now. These suggestions can come from you, they can come from us from the ERS, they need to come together. So we're going to work together on at least some of the key symposia for next year. If you've got ideas, talk with the European Lung Foundation, they can help guide you, speak to your assembly colleagues and ask them to help you pull together symposia and different sessions together. But be innovative. You've got a message you want to get across. Don't feel constrained. If it's totally impossible, the ERS are quite good at doing totally impossible things at Congress. We did have a robot here last year. So, you know, be innovative and think about it, and let's see what we can do together. But it's not just symposia. That's the first thing people think of, but there's lots of other formats within the Congress, and if it doesn't fit one format, it might fit another. Don't forget the studio sessions. Often they're an opportunity to do something really different and really innovative. So think outside the box and come to us with some ideas. Come to your assembly with ideas and think together about the message. Abstracts. join us with abstracts. I do hope some of you are involved in research with us, actually help support our abstracts. I certainly hope that my patient colleagues, the projects that I'm working with, will help support the abstracts. And of course, the World Village, what can you do there to get this message across? We're in this together. And it's not just the Congress. We have a lot of webinars and events online that lead up to the Congress. This year we've had a series of 6 webinars about global themes. What could we do next year? I know you've had your Global Voices campaign, which is wonderful. What could we do next year? We're looking for ideas. It's early days yet, we've got time, but now is the time to think and we'll inspire each other so that we have a really great Congress next year. What's my vision? Congress has lots of functions. We learn, we network, many, many things. We present our research, many things, but one of them is definitely to inspire and to stimulate ideas, to broaden people's horizons and perhaps challenge preconceptions. And next year, I'm really looking forward to being inspired, working together to take a new look at the value that partnerships can bring, whether it's individual, whether it's in groups, whether it's in research contexts, and the value that they can bring to our lives, to our clinical work, and to research. Let's join together and see what we can do next year. Thank you.
Lovely.
Thank you, Hilary.
Thank you.
As Dimitris mentioned earlier, this is the 10 years ELF has hosted this networking day. To help us to celebrate, I invited Michaela Odemir to share with us her memories and standout moments. Over to you.
Thank you so much. Well, the first time I came in contact with ELF, I was newly elected president of IFA, that is an umbrella organization for asthma, allergy, and COPD patients. And I was very, very nervous. I didn't know what was it expected of me to do. So what did I then remember? Well, first we had the presentation that we had like this morning. We were walking around and presenting ourselves. And I remember Dan, who was then the president, say, remember when you present yourself that we are equal. And I was thinking all the time, how should I present myself? And a lady came to me with her hand and said, hello. And I went, hello, I'm Michaela. I'm just the president of IFA. Well, the effect was not perfect. And of course, it was my fault. But the friendliness and the kindness I felt in that room, it actually took away that feeling bad that I did something wrong. And then there was a choir, and they all have asthma, and they were singing so beautifully, and I was so amazed by this. So when I got home, I met with the choir and said to them, oh, do you know what I heard in London? They were singing beautifully. Oh, I have asthma, even though they have asthma. And he said, wow, this is a very good way of recruiting new people to our choir. And then started the meeting. And the way he spoke about patient involvement, it came directly from his heart. We had a long chat after the meeting, and he became a true friend and mentor for me, encouraging me to be more and more involved in ELF. Actually, he was pushing me, but in a very friendly way. Thinking of him and Isabel Saraiva, who is also the past president, it makes me both sad because they are no longer here with us, but at the same time very happy, because when I have met them, I have learned so much, and they have been an inspiration, not only for me, for many other people. And it was Dan who was initiating and driving these early events, making sure that patient organizations had a place at the Congress and dedicated time to come together and share more experiences and learn from each other. So I joined, of course, because everything felt so right, important, and it was really what was needed. My husband always say, when you go to a meeting, please try to be quiet, otherwise you will be involved again. Well, here I am, 10 years later. I'm very glad I spoke up. But during these 10 years, I have seen with happiness how more and more people and organizations are being involved. And this year, we are fully booked. That had never happened before. And I also realized that in the beginning, when we were having our meeting, we were quite far away from everything, and now we are closer. And I can also see that more and more people are involved, like Hilary said, also as speakers or in videos. And not only have we visited many beautiful cities, I remember one, it was in Paris, and our patient organizations there in that country are also always involved. And I must say, Lilia, I will never forget your hat. It was beautiful. Of course, it has been sometimes challenges, but this is a learning process. And hearing from others how you work, what you do, and how you achieve your goals is so inspiring, and it's a spirit of dance initiative. After him, we had the pleasure of having Isabel Saraiva from Portugal, Kjeld Hansen from Denmark, and now we have Dimitris Kontopidis right now. And seeing a patient being in the front and making sure that we are being heard is crucial for advocating and change. A wise man in Sweden said, it was actually the Deputy Secretary General of UN said, the most wonderful word in the world is together. I saw together also on Hilary's presentation. So I want to thank all the people who have helped with planning over the years, these events. And I also want to thank Pippa with her staff and ERS for their wonderful work. And thinking of Dan now, for if he could see us, and he will, what have happened from that first meeting until now. During now, there will be a small gift that we'll be handing out to you, and a short video will be shown now over the years. So I thank you and enjoy.
In 2019, at the ELF Patient Networking Day, inspired us to invite her to join us at the Ibero-American Conference, measuring the impact of air quality on our respiratory health. This also led to her participation in the documentary Breathe Mum, and to us to take on an important campaign globally, Clean Air, Healthy Lives.
The 2022 event inspired us to strengthen our collaboration with other respiratory organizations in Greece and abroad. The positive feedback we received after our presentation gave us motivation and inspiration to expand our self-management programs and public awareness projects even further. We are proud to have been part of this event and looking forward to many more years with mutual support shared knowledge, and cross-border patient advocacy.
Mental health was the topic discussed in Milano 2 years ago during our patient organization networking day. So during the sessions, contributors made it clear that it is a priority not only for quality of life for patients and their family, but also for the survival of patients. And back to home, I was asking myself, what can we do to influence change and not only stating the facts? So that is why we launched the Mental Health Working Group in early 2024. We will very soon be launching a survey to associations and healthcare professionals to better understand what exists and what is lacking in our different countries. And we are also preparing a first aid emergency kit that can be adapted by everyone. So together, patients and healthcare professionals, we have the power to make a difference.
As a patient advocate living in rural Ireland, attending my first ever patient organisation networking day had a huge impact on myself and how my organisation grew. Learning from others, how we learned what could be achieved, the lessons they had learned. And now 10 years later, my experience has told me that every year I can still learn. So I encourage everyone to attend these patient organisation networking days and to learn like I did, and to grow along the journey of patient advocacy.
I would like now to ask Dimitris Kontopidis, ELF chair, to come to the podium. He's here.
Thank you.
To give his closing remarks and to wrap up today's event. It's been a great day. Many thanks to all our speakers and to my co-chair, Marion.
Thank you. And thank you all for participating, but also for all your action and to the power in that room here. It's over to you, Dimitri.
Okay, thank you very much. Now is the best part, I think, that we are finishing. We have learned so many things. We have learned to survive in very cold era. And definitely next year in Barcelona, I hope it will be more warm. Okay. So I don't know if you have kept some notes. I have kept my notes. And I will tell in a bullet way, very quickly, what I have to take with me. Also, I feel that we have to take your notes. Maybe it's common, maybe it's not. So what I keep from today, first of all, I would like to thank ERS President and President-elect on emphasize the role of the patients. It's important a lot of times to hear from the doctors that they need us and they need our opinion. Second bullet is to congratulation for the team Our Kids Climate, the mothers that we hear in the start, that take care, not only their kids, but generally the kids. And it's a wonderful initiative that maybe we can take for home and to do something in our country. Third bullet, of course, we have to thank WHO working for the patient and emphasize the importance of patient association and opinion in all the in all the challenges that we are facing worldwide. And the third bullet is multi-bullet. It's regarding the workshops that we do and working tables. I have kept some notes. The first, it was very nice to link this resolution of WHO with patient experience and to get related with ground root movements or the topic societies. The second one is to include youth, because they have a lot of power and this is our future, of course. The third bullet is that we have to mapping and matching, not to starting from the scratch, because there is a lot of knowledge out there, a lot of good examples that we can take and use them. And the final bullet from the working session is to working collaboratively. That is the key that also Michaela mentioned before. So more or less, this was my notes. And we are going to the next slide and the final slide, what it is. Here is the schedule of the next days and what we can do. Tomorrow, keep notes. Tomorrow, the only important thing for us is to be part of the respiratory tests outside there and to enjoy also Amsterdam. The second thing that I have to mention is the first year that we're doing. We have ELF Bingo Challenge. There is a game that if you complete these 6 tasks, you will be in a lottery to gain some nice gifts related to our health. I think it's some bracelets that we measure the activity that we do. And you have take for free this keyring of the 10 years already. What is next? We have the active options in Tuesday. And if you can wake up very early, you can join the run, long run. If you are trained, I feel that a lot of us could join, even for a few kilometers. And the final day that we have a task to do is the studio sessions that some members of our community will go live to be part of some conversation. So that's it. Hope you have enjoyed. You have taken your notes and we'll go to the last poll to see what we have learned. But be honest, as I asked you before, to see the progress if there is a project. So you have some seconds. What is the knowledge that you have gained regarding your organization that can support WHO lung health resolution? And we have dedicated so much. Wow! Everybody is the same honest number, 5. We have learned a lot. There is still place to learn more next year. So that's it for us. Thank you very much for joining with physical presence, online presence, and the bigger and the more noise, applause, how we call it, this, it goes to ELF staff and the technicians that help us to make it happen. Thank you very much. Hasta pronto, next year, Barcelona. Thank you.